to highlight some of the key achievements under the Onse project. And that is why, for that reason, I would like to invite the Chief of Party, Dr. Anne Poya, to come forward and just quickly take us through the objectives and introduction of the delegates that have been invited to attend this event. Dr. Poya, please. Thank you.
Thank you, Director of Ceremonies, Honorable Minister, Honorable Kumbize Kandodo Chiponda MP, Your Excellency Ambassador Young, Secretary for Health, Dr. Charles Mwansambo. Forgive me, I forgot my own brother, the Deputy Minister of Health. Every time I look at him, I see a clinician running for quality improvement. I recognize you being here. I recognize Lile Banda, the Deputy Head of Health and Nutrition at USAID. All other protocols observed. My role, indeed, as mentioned by the Director of Ceremonies, to share the objectives of the conference, but also to make some introductions. Since there are so many of us, I will not be able to call everybody by name or ask people to stand up and give up their names. So we will be introduced through our groupings. I will start by asking if we have any district commissioners in the midst of us. Can all the district commissioners stand and wave to the people? I know we invited the district commissioners. Thank you, district commissioners, for coming. May I invite the directors of health and social services and your team. These were the implementers, the owners of the project. Directors of health and social services and your members, please, can you stand up? So these are the representatives from the 16 districts. We worked with the partners. May I invite implementing partners that we invited if they are here? Implementing partners? None of them have come. Please wave to the team. Thank you. I know that the implementing partners are representing a lot. For example, the ZPIH, World Relief, Bela, JISI, just to mention a few. We also worked together with the support from the Health Donor Group. Do we have representatives of the Health Donor Group that are led by UNICEF this morning? Because UNICEF is the chair of the Health Donor Group. I saw WHO somewhere here. So the donors are not here. At least the WHO is here. I hope the others are on the way. We also invited the regulatory bodies. Are the regulatory bodies here? Medical Council, Nurses Council, the Pharmacy, and the Medicines Regulatory Board. Thank you, regulators, for coming. We also invited the academia, people from the universities, the training institutions here. Can they all stand? Thank you, Vice Chancellor from KUHES. I see you. You are welcome. And the rest of the academic staff. Lastly, but not least, I would also like to invite members of the community, led by the community ambassador, Maziko Matemba. And I know that we also have a chief in the midst of us, Chief Nkata from Kabudula area. Afumu mulipo? Afumu Nkata mwabwera? Probably the chief is on the way. She might have been busy sorting out community issues. Professional associations. We invited professional associations, Association of Malawi Midwives, Association for the Obstetricians and Gynecologists, Associations for Pediatrics and Child Health. Are we here? I think they're sorting out. I see the midwives here. May I now also invite a team from MSH Home Office. If you are here, please wave to the team. Thank you. Now may I invite the Onse family. Onse family, I'm sure I'm not the only one from Onse. So these are basically the people that are here, but I would now like to introduce the high table to the participants. I would start from the Secretary for Health, Dr. Charles Mwansambo. Can you kindly, please, thank you. I would also like to introduce my colleague, Lily Banda, who is the Deputy Head of Health, Nutrition at USAID. I would like also to introduce the Deputy Minister, Honorable Enoch Pale, our own health worker. May I now also introduce Ambassador Young, Takulandirani Bwana. Thank you. And lastly, I would like to introduce the Honorable Minister, Honorable Kumbize Kandodo Chiponda, our own health worker as well. Thank you. So that's the team that is here today to celebrate with us. I'll just take you through the three objectives that we have for this conference, because sometimes it is a challenge. You go to a meeting and you wonder, what was this meeting all about? But this meeting has objectives. The first one is to share Onse's achievements, the knowledge that has been generated, and experiences to the Ministry of Health policy makers and the other health sector players, because we think it is important for people to know what exactly has this project achieved. But another objective is to advocate for the incorporation of the high impact interventions that Onse has implemented into the National Annual Implementation Plan and the district health plans. Let me also mention here that we would like to advocate that the interventions we have seen there are incorporated into the health sector strategic plan number 3 that is coming up. And lastly, we want to share and celebrate project successes and the impact as well as the differences that Onse has made in the lives of Malawians in the 16 districts. Thank you. These are the objectives of the meeting.
Thank you very much indeed, Dr. Ann Poya, for those introductions. When you called for Onse staff to stand, I thought everyone was going to stand, because Onse in Chichewa means everyone. So I thought some people were going to misunderstand that, but it looks like people still got the sense. Thank you so much for that. Allow me, our guest of honor, to invite now Ms. Kate Langwe to come forward and give us the welcoming remarks. She's the Ministry of Health Onse focal person. Thank you.
Thank you, Master of Ceremonies. The Minister of Health, Honorable Kumbize Kandodo Chiponda MP, the Deputy Minister, Honorable Enoch Pale MP, Your Excellency, the U.S. Ambassador to Malawi, Mr. Davis Young, the USAID Mission Director, Ms. Melissa Francis, and all USAID senior members of staff, Ms. Lily Banda, Secretary for Health, Mr. Dr. Charles Mwansambo, the Chair of our Parliamentary Health Committee, Dr. Matthews Ngware, MP, the Chair of Health Donor Group and USAID representative, Mr. Rudolph Schwenk, the District Commissioners, and all directors of health and social services, and all government officials present here, including the officials from our Ministry of Health, the Onse Chief of Party, Dr. Anipoya, and all your team, and all the implementing partners here present, members of the media, and ladies and gentlemen, good morning. Today marks a major milestone of the Onse health activity. Onse is a USAID health flagship project which costed at more than $100 million, as designed to support the government of Malawi to address some of its challenges, specifically high morbidity and mortality rates among pregnant women, neonates, and children. As so many factors contribute to morbidity and mortality, Onse was a very complex project implemented through different partners and different players at different levels of the health service delivery, as you heard during the introductions. At policy level, Onse was housed in the Department of Planning and Policy Development in the Ministry of Health, and as a director of this department, I was the Onse's focal person providing policy guidance for the project so that it's aligned to the National Health Sector Strategic Plan. At district level, the directors of health and social services were supposed to delegate at least one member of the DHMT to serve as Onse focal person at that district level. And the main role of this focal person was to monitor implementation of the Onse district plan, which was nested in the district implementation plans. And then down at the community level, Onse was implemented through community structures, as we appreciated in the pavilions. And these structures were implemented through chiefs, area development committees, village health committees, community health action groups, that's just to mention a few. And these structures were supported by health surveillance assistants. And at facility level, it was the health workers who implemented all the interventions supported by the project. As Onse was a technical support project, all the implementation levels I have mentioned received technical support from a number of MSH as a prime partner, and of course other organizations such as MSI, BLM, DMGI, Village Reach, and overseas strategic consulting to provide technical support in specific areas of this project. There were also other local organizations that played a critical role in demand creation and WASH interventions. The Onse team provided technical support in all clinical interventions, WASH, and of course, infrastructure development. It is therefore my humble duty to thank all these partners for a job well done, and of course the Onse team for coordinating all these activities through all these organizations so that we achieve our common goal of universal health coverage. Thank you so much, and thank you for your attention.
Thank you very much indeed for those remarks. Now, in the introductions, Dr. Poya did invite MSH, MSF to stand, and MSH as well. I would like to invite a representative from MSH, the Vice President, Strategy, Development and Partnerships, Ms. Dana Sandstrom, to come forward and address us. Thank you.
Good morning. Should I say that again? When I say good morning, You say good morning, right? This is the kind of event where we're not just sitting and listening, that this is about engaging today. So I'll try it one more time. Good morning. That's better. We're together. The Minister of Health, Honorable Kumbize Kondono Chiponda MP, the U.S. Ambassador, Mr. David Young, Deputy Minister of Health, Dr. Inek Bale, the Secretary for Health, Dr. Charles Monsambo, the USAID Deputy Head of Health and Nutrition, Lily Banda, and senior members of USAID staff, the Chair of the Health Donor Group and UNICEF Resident Representative, Mr. Rudolf Schwenk, and other development partners, representatives present, and all other protocols observed. I'm so thrilled to be here with you today. I lived just up the road in Lusaka for 10 years, and just to close my eyes and breathe the air this morning conjured up so much emotion. The last time I was here was actually 5 years ago to help the Onse team get this project off the ground. And I'm inspired to find that the optimism and tenacity that was so palpable within the team then is still very much present today. But you see, that's because we're more than implementers, we are advocates, called to action by the global movement to ensure healthy lives and promote well-being, and in service of our mission to close the gap between knowledge and action in public health, unrelenting until every mother, father, and child everywhere has access to good quality health services, which are their human right. Those who have been leading the work will share their reflections on some of the most significant accomplishments of the last 6 years and challenges that still lie ahead. I'm struck by two things that I wanted to mention this morning. First, as a mother, the fact that we've been able to support the ministry to resuscitate tens of thousands of newborn babies who had trouble breathing at birth is astounding. And that's the definition of high-impact intervention. I know what it's like to turn up at a facility just up the road, threatening preterm labor, and be told, we haven't handled a 27-weeker, and do you have your blood donors lined up? My own kangaroo baby just turned 9, and I'm grateful for him and for the health workers who helped shepherd him into this world and keep him here every day. And I'm grateful that tens of thousands of Malawian families also got to go home with their babies with the support of USAID and Onse. Second, I'm struck by the resiliency of the Malawian health service, communities, and our team in the face of the major and unforeseen obstacles experienced during the course of this project. A true testament to the strength of partnership is the ability of all parties to see the problem at hand, to sit together and get to work, bringing the best that each has to bear regardless of what has been planned. In closing, we want to thank the government of Malawi, USAID, partners, and communities for your partnership over the last 6 years of Onse. Nothing is perfect, but we woke up each day with a sense of urgency and commitment to keep moving forward. MSH remains steadfast in our commitment to continue working together to support Malawi's journey to 2063. I'm so excited to get on with the program, and with that, I'll hand it back to the Director of Ceremonies.
Thank you very much indeed, Dr. Sandstrom, for that, for those remarks. Now, our guest of honor, ladies and gentlemen, this project wasn't going to be successful if it wasn't for the support that we got from the American people. So I would like to invite Ambassador Young to come forward and address us this morning. Thank you.
The Honorable Minister of Health, the Honorable Deputy Minister of Health, the Secretary for Health, the Chairperson of the Health Donor Group, the Chief of Health Services, and all directors for the ministry here present, the District Commissioner for Lilongwe and other District Commissioners, Chair of the Parliamentary Committee on Health, Management, Sciences for Health, Vice President for Strategy, Onse leadership, Onse project staff, those staff who were at the booths that we visited this morning, colleagues of USAID, members of the press, distinguished ladies and gentlemen, Onse, everyone, good morning. Morning, Onse. On behalf of the U.S. government and the American people, I am deeply honored to be here today to commemorate and acknowledge the extraordinary work that Onse has done in partnership with USAID over the past 6 years. Literally, tens of thousands of Malawians have benefited from our partnership together to live better lives, to live safer lives, and indeed to have the gift of life. The United States government and the American people, through the U.S. Agency for International Development, or USAID, work hand in hand with the Malawian government to expand health services, particularly to the most vulnerable and disadvantaged communities. Through USAID's flagship health program, the Organized Network of Services for Everyone's Health Project, Onse, we have invested more than $100 million, 800 billion kwacha, over the past 6 years to support the government of Malawi to accelerate its efforts in reducing maternal, newborn, and child illness and deaths. We work closely with the Ministry of Health in 16 district councils to implement programs that increase access to high-impact health interventions and quality services in the areas of maternal, neonatal, and child health, family planning, malaria, nutrition, water, sanitation, and hygiene. Our investments have strengthened health systems through redeployment of staff in hard-to-reach areas and supported improvements to equipment and infrastructure, supply chain management, health management information systems, and service delivery. I would like to share just a couple examples of how we have strengthened health services delivery over the past 6 years. We provided mentorship to nurse midwives like Ronnie Mazava from Kamboni Health Center so that they can skillfully and successfully manage labor complications. Ronnie is a hero because through the work that Ronnie has done, babies are alive today. What an extraordinary gift. We renovated 17 health centers that are designed to serve as basic emergency obstetric and neonatal care facilities, and we renovated a skin clinic at Kamuza Central Hospital. All of those who work at those health centers are heroes. They have saved lives and helped deliver babies and allow babies to grow up into healthy adults and be productive citizens here in Malawi. We provided essential equipment for delivery rooms, nurseries, emergency triage assessment and treatment corners, and nutrition rehabilitation units. We financed, working together, the construction and maintenance of water supply systems in 78 health centers across 11 districts, and we repaired boreholes in 219 communities. Think of the human impact of those interventions, person by person, baby by baby, family by family. That is extraordinary cooperation. That is an extraordinary 6-year legacy. I recently had the opportunity to visit Matawale Health Center in Zomba District, which is just one of the health centers supported through Onse. And I saw firsthand how our investments are making a difference and changing lives for good. I was impressed by the stories that I heard from clinicians and patients about how clinical services have been strengthened and health outcomes have improved. In room after room, as we moved through the health center, I saw charts showing the improvements in outcomes for patients. And I met new mothers like Rebecca and Kundinka who were bringing home healthy new babies. What a joy to think that together we are giving new life to healthy babies who can grow up and be the leaders and citizens of your country for the future. The work that you do is sacred work. It saves lives. It changes lives for good. Honorable Minister, these are just a few examples of our partnership, and I know there is still significant work to do. As a long-standing partner to the government of Malawi and the Malawian people, the U.S. government and the American people will continue to work with you to improve access to and the quality of health services. As we look forward, we are committed to building on the progress that we have made through the Onse health activity. And we are confident that our continued collaboration will move us closer toward our shared goals of preventing child and maternal deaths, controlling the HIV/AIDS epidemic, and combating infectious diseases. A healthier and more self-reliant Malawi is within reach, and our work together is helping save lives and change lives for good. Rebecca and Kundinka, those mothers who have a better life because of our work together, say thank you, and I say thank you too. Zikomo Kwambiri.
Thank you very much, Your Excellency. And we are highly indebted to the American government for the support that it gives to Malawi through projects like this and many more. Please continue doing so. It's hugely appreciated. Thank you. We're now going to listen to a speech from our guest of honor, but before he comes, allow me to invite Dr. Charles Mwansambo. He is Secretary for Health, to come forward and deliver his remarks, but also to invite our guest of honor to address us this morning. Dr. Mwansambo.
Job, you've broken the tradition. I thought you were going to say, now we're going to listen to a song by the Health Education Band. But anyway, we'll go according to the way you've put it. Honorable Minister of Health, Honorable Kumbize Kandodo Chiponda MP, Honorable Deputy Minister of Health, Honorable Enoch Pali MP, Your Excellency Mr. David Young, the U.S. Ambassador to Malawi. Let me also recognize Lily Banda, the Deputy Head of Health at USAID. Madam Dana Sandstrom, MSH Vice President, and the rest of the team from the US. And I also have Melissa Francis here, USAID Mission Director, and all USAID members of staff here present. Honorable Matthew Ngwali and any other parliamentarians we may have in the room with us this morning. Honorable Ngwali is the chair of the Parliamentary Committee on Health. Let me also recognize the Vice Chancellor of the University, Kamuzu University of Health Sciences, Professor Mark Malewa, and all other members of the academia present in the room. Madam Kate Langwe and all directors from the ministry and other government officials present here this morning. Rest of the team members from Onse, this time not talking about everybody here, but this organized network of services for everyone. The chairperson of the Health Donor Group, Rudolf Schwenk, or any other members of the Health Donor Group present here. All district commissioners present here, directors of health and social services, and your teams that are here. Dr. Ann Poyer, who is the Onse Chief of Party. Mr. Maziko Matemba, our Community Health Ambassador, and all members of the community present here. Representing civil society, the Malawi Health Equity Network leader, George Joby, and your team that are present here. Group Village Headman Mfumunkuta, and all other traditional leaders present here, implementing partners, invited guests, members of the press, ladies and gentlemen, good morning. You'll be pleased to hear that my salutations will be longer than my speech. Allow me, Honorable Minister and Excellency, to say a few words before I invite you, Honorable Minister, to address the gathering. The Minister of Health is very grateful to have received support from USAID Onse Health Activity for the past 6 years. The support means a lot in terms of health service delivery in our districts, as all project interventions were planned together with district teams to ensure alignment with the district implementation plans. We congratulate Onse for the job well done. We just saw it by the displays that were taken around this morning. And moving forward, the Minister of Health and the district councils will sustain the gains made through the project by integrating the Onse-supported interventions into the current district implementation plans, and also the upcoming health sector strategic plan 3, which is currently under development, and also ultimately contributing to the health goals of Malawi Agenda 2063. I urge your district councils to take good care of the infrastructure by including maintenance costs in your council budgets. I did promise that I was going to keep my speech short, and I'll stay with that promise. With these few words, it's now my singular honor to invite the Honorable Minister of Health, Honorable Kumbize Kandodo Chiponda, MP, to address the gathering. Honorable Minister, thank you.
Thank you so much, our Secretary for Health, Dr. Masambo. In a special way, let me recognize the presence of our Deputy Minister, Honorable Ino Kipale MP, also His Excellency Ambassador David Young, Ms. Dana Strastrom, MSH Vice President for Strategy and Partnerships, Ms. Melissa Francis, USAID Mission Director, and all USAID senior members of staff present this morning. Honorable Matthew Zingwale, MP, our chairperson for Parliamentary Health Committee, or indeed his representative present this morning. Kate, Director of Planning under the Ministry, and all directors and deputy directors and all government officials who are present. Ms. Myrian Grenon, Onse Portfolio Director, Mr. Rudolf Schwenk, Chairperson of the Health Donor Group and UNICEF Resident Representative, and all other development partners here present, all our district commissioners, or indeed their representatives who are present this morning, the Vice Chancellor, Professor Malewa, and all from the academia, all directors of health and social services from the Onse supported districts, and all your members of staff present. In a special way, Dr. Anne Poya, Onse Chief of Party, and all Onse members of staff who are present, Onse champions who also took part in the pavilions, Mr. Maziko Mademba, our Community Health Ambassador, George Jobe from Mayhen, and all representatives from CSOs, and also all members from our implementing partners who are present with us this morning, members of the press, and of course our Director of Ceremonies, Mr. Joab, who is coordinating this morning. Good morning. Allow me, distinguished delegates, to join the Director of Ceremony in welcoming you to this dissemination conference organized by the USAID Onse Health Activity. I am delighted to be here with all of you this morning to celebrate the USAID Onse Health Activity. Today, indeed, it is a happy day for my ministry, and I believe a happy day also for the 16 district councils where Onse project was being implemented. I've been wondering about this name. What a befitting name, Onse. I don't know who came up with this, but it was a very, very brilliant acronym, Onse, meaning together. Your Excellency, distinguished ladies and gentlemen, when a sickness hits home, everybody else is involved. When a child is sick in the house, everyone, the father, the mother, even siblings, all of them, they are affected. When the mother is sick in the house, all of the household members, they are affected. Equally, when you have a sickness in our community, in our villages, it is not about just the immediate family members. Everybody else within that community is affected. So that's why I said this name also is very, very befitting to the activities which were happening. Your Excellency, ladies and gentlemen, I'm happy because of what Onse has done for the health sector in the last 6 years. We have heard from our champions, but also from the ambassador, that Onse project was a flagship program funded by the United States government to support Malawi's health sector. The funding level of more than 105 million US is not a small donation. For the Malawi health sector, these funds filled a large gap in the health sector budget, and indeed it made it possible for the district councils to deliver essential health services in our communities. Specifically, we have heard from the brief remarks from the MSH Vice President, as well as the remarks from the Ambassador, that the funding has supported Malawi to address issues of access, issues of equity, and indeed issues of quality in the delivery of essential health services with a focus on maternal and child health issues. Without this financial support from the United States government and indeed from our development partners, implementation of the HHSP2 would have been a tall order for our government. As you are aware, that the mandate of our Ministry of Health, is to deliver health services that would enable Malawians to achieve the highest possible level of health and quality of life. I would like, therefore, to thank the United States government, through you, Ambassador Young, for the financial resources given to Malawi to deliver essential health services in the 16 districts that were being supported by the Onse project. From the reports that we shared with my ministry, I'm confident that the interventions that were implemented in the 16 districts have contributed to the improvement of maternal, neonatal, and indeed child health outcomes. And they have also contributed to the reduction of the maternal, neonatal, and childhood mortality. For example, like we have heard, the project supported generation of 3.8 million couple years of protection through provision of family planning services. But we have also heard that we supported the resuscitation of over 40,000 newborn babies. You can imagine, you carry a baby for 9 months, and when you have given birth, that baby is not alive. What a devastating effect it has on mothers. So for us to support over 40,000 newborn babies, it is indeed a miracle. But we also supported the treatment of 1.5 million under 5 children who had diarrhea by providing the wash services. I'm sure that the statistical gurus in our midst today can advise us how many maternal, neonatal, and indeed under 5 children deaths that have been averted by these interventions being provided by the Onse project. Your Excellency, ladies and gentlemen, I would also like to commend the Onse project for its commitment to equitable distribution of high-impact interventions to all people irrespective of their place of residence and indeed even their region. Onse did not only support facility-based care, but it also supported district councils to reach out to populations that reside in hard-to-reach areas. Your Excellency, distinguished guests, Malawi is still far from reaching its policy goal of having its people reside within 5 to 8 kilometers of a primary health center. And that is why, Your Excellency, that even our state president, in his first persona as the president of Malawi, he stated that we need to construct over 900 health posts in the country in order that our people travel short distances to access health services. Through the Onse project, it is noted that the 16 districts managed to conduct more than 10,000 outreach clinics where more than 2 million people accessed essential services. I need not to remind you, colleagues, that without the project, these 2 million people would not have had an opportunity to receive any type of care for the health problems and needs, which included, but of course not limited to prenatal care, family planning, immunization, nutrition, counseling, HIV testing, as well as malaria diagnosis and also treatment. To complement these services, it is pleasing to note that Onse supported over 2,000 village clinics which are being run by our health surveillance assistants in the rural areas targeting the sick under 5 children. It is also important to note that when these services are not accessible to people that need them, it will be difficult for the country to improve health outcomes for the rural population, especially living in the hard-to-reach areas. Your Excellency, ladies and gentlemen, these are indeed quite a number of areas that Onse project has supported the country. As such, it would take me a whole day to comment on all of them. I will therefore conclude my remarks by commenting on the 2 other critical areas that the health sector benefited from the project. The critical areas include support for public health emergencies and indeed support towards WASH. We are all aware that most of the projects are designed with very little room to maneuver. As such, it is not easy for them to respond where eventualities hit the ground. Onse demonstrated great flexibility by supporting our facilities to respond to emergencies. You are aware, all of us here, and indeed Your Excellency, that COVID-19 hit us so hard when we did not anticipate it. And therefore, the response which was given to us by Onse, especially through the support to the vaccination and also to the trainers of the vaccinators, we really appreciate that. And also, we also appreciate the humanitarian support given to us, especially due to cyclones Idai, Anna, and Gombe. Through all these strategies, Onse came through to support districts respond to the challenges. Onse was the first project that supported establishment of a formal emergency treatment unit in the country at Kamuzu Central Hospital. Your Excellency, distinguished ladies and gentlemen, most of us were aware of the situation which was at Kamuzu Central Hospital. Your Excellency, our patients, they were lining up in all the corridors. There was absolutely no room at Kamuzu Central Hospital in order to support our COVID patients. Furthermore, in Chitipa, also supported construction of a holding unit that is now assisting the hospital to decongest queues at the outpatient department and achieve physical distancing as a preventive measure against the COVID-19 infection. In addition to the civil works interventions, Onse has also been a trusted partner in the implementation of the COVID-19 district response plans that included the demand generation, for the uptake of and indeed administration of the COVID-19 vaccination. And here today, they have also done that. We have a vaccination center, which is right here inside this room. And for that, we are grateful. Ladies and gentlemen, your last support that I would like to comment on is the support of the wash amenities. The importance of good sanitation and indeed access to safe water to positive health outcomes was embraced by the Onse project. 12 health facilities today have modern mechanical incinerators. 17 health centers have been provided with boreholes and the reticulation system to have running water at the facility, where additional 16 health centers have been renovated to create a conducive environment for the delivery of dignified and indeed quality care. Your Excellency, distinguished ladies and gentlemen, the importance of clean potable water cannot be overemphasized. During COVID, one of the issues which we're talking about, we were encouraging people to wash their hands. How can you wash your hand when you have no water? We have now cholera in about 96 of Malawi, and one of the preventive measures, it is washing hands. You don't know, Your Excellency, how many lives we have saved just by the simple act of saying we need to wash hands. But for us to wash hands, we need to have clean and potable water. Ladies and gentlemen, Onse has indeed left a long-lasting impression in our health facilities. Let me therefore take this opportunity to request you, Ambassador Yang, to convey a message of gratitude and thankfulness to the U.S. government and indeed to the people of the U.S. for their support. The government of Malawi, through my ministry and through the district councils, are committed to ensure that these investments are well sustained for improved health status of the people of Malawi. Your Excellency, what we like about the Onse project is also the part of building capacity. In our culture, in our language, you say, you did not bring the fish to us, but you have taught us to fish for ourselves. And for that, we are grateful. May I also take this opportunity to recognize in a very, very special way the health workers who implemented the projects and the Onse team that provided the technical support to the district health teams to achieve the project goals. These are indeed the true champions of the project, as their dedication and passion for health delivery is what has produced the good results we are celebrating here today. Further recognition of appreciation is given to the other development partners that have also worked tirelessly in supporting the implementation of the national and district health plans. It is my hope that all our development partners, including the U.S. government, will continue to support the health sector, especially now as we are about to usher in a new health sector strategic plan. With these few remarks on behalf of the Ministry of Health and indeed on behalf of the Malawi government, I would want to officially invite all of you to celebrate with us the achievements which have been we have been able to do through the USAID Onse health activity, and I'm looking forward to future USAID endeavors in Malawi, especially as we get close to the SDG countdown and also to the start of implementation of the Malawi 2063 health agenda for the nation. With these few remarks, I would want to thank you so much, Your Excellency, for making it today, and thank you all Onse members who have made it possible for us to be here. Thank you all the organizers of this function, our district council representatives, our DHHOs, the academia, our CESOs, partners, all of you, thank you so much. And thank you to all those who gave briefs in the pavilions. You represented us very well, and we are so proud of you because you are the people who are working on the ground. God bless you all. God bless the people of Malawi, and God bless the people of USA. Thank you.
Thank you very much indeed, guest of honor, for those remarks. Onse is quite a peculiar abbreviation, and in Chichewa, if you want to include yourself in the group, you say Tonse, which is what the Honorable Minister did. That doesn't turn Onse into a political grouping. It remains an initiative that is determined to bring good health care and health services to all Malawians. Thank you so much for those remarks, Honorable Minister. And I see that the Secretary of Health is quite keen to have the band entertain us. I will invite the band when the right moment comes. And when that moment comes, I will challenge him to a dancing competition right here. And the Chief Judge will be the Honorable Minister himself, representing the Malawi government. We're going to take a quick break, ladies and gentlemen. A few announcements before we take our leave. The high table, including the delegates that were invited, are invited to take a group photo. So there is an exit right here, I'm told. So I will invite them to exit through that door and have a group photo taken right outside, after which there will be some brief media interactions. I'm sure the media have got a couple of questions for the Honorable Minister, as well as all the necessary individuals they want to talk to. But for the rest of us, we are invited to tea or coffee or whatever drink you want to have. It's been laid out by the pool side. So the rest of us will exit through the main exit there, and we'll make our way to the pool side where refreshments have been laid out. The tea break was allocated 15 minutes. I'm just reading what's on the program. And this is 11:15. If we leave right now, I'm sure we must be back by 11 o'clock. And I would like to invite all of us to come back, please, because there's still more that we have for you. Thank you so much. May I invite our high table to lead us out as we go to get the group photo taken. Thank you so much. Invited delegates, don't forget to join the high table in the group photo, please. Invited delegates. Ena tonse ti kupemphedwa kupita kumene kuli swimming pool kuja, ndi kumene kwakonzedwa zakudya ndi zakumwa. Tipite kumeneko kuti tikalandire zakudya ndi zakumwa, koma please chonde tionetsetse kuti kamati 11 koloko tikhalenso titabwera mchipinda muno. Choncho tiyeni tinyamuke nthawi ino. Zikomo.
As a champion community, tinachiona kuti tili ndi mavuto akuti kuno kudera kwathu kwa Chakupomba, tinakhala pansi ndikuganizira ndikulingalira kuti vuto lathu ili monga mavuto tinapeza atatu. Pa mavuto atatu limene nakula kwambiri ndikudwala kwa ana ndi malume. Zina langa ndine Clayton Steve Chingaliwa. Zina la gulu lathu ndi Chakupomba Champion Community. Ni Champion Community omwe ndine secretary. Chomwe chinatipangisa kuti tipange chitukuko chimenechi ndi mavuto amene timakumana nawo. Aja tinanena kuti ndi mavuto atatu mdera mwathu muno. Kudwala kwa ana under 5, komanso malaria ingani ya nutrition. Champion Community azimayi amakumana ndi mavuto kuti akachoka kunyumba kwawo kuti azipita ku health center imene yochuluka makilomita 7 amaberekera njira kukafika kuchipatala atabereka kale mchira. Vuto limene linatikuza kwambiri ngati za Champion Community. Ndiye tinakhala pansi ndikupanga chiganizo choti timange clinic. Chimene chinatipangisa mavuto amene. kale zinthu zimakhala zovutirapo poti chipatala chinali kutali kwambiri, koma pano tikuona kuti zinthu zikuyenda poti chipatala tamanga masevisi onse timalandirapo mpano. HSA athu amachoka kuchipatala kuja kutali kuja kubwera pano zatipasa masevisi onse, ndiye zimationesa kuti pano tayombako kuti moyo wathu uli bwino kwambiri, zinthu zasintha kusiyana ndi kale. Budget yathu ngati community imene tinagwirizana kuti timange clinic inali ya 3 million. Ndiye ndalama zimene zinazipezera njira zitanena kuti tinasegula matimba. Kenako tinapemba achibara imene ku South Africa kudera konkuno anathandizanso ndalama yokwana 600,000. Masomphenya athu ngati champion community tikufunisisa kuti chipatala chimene chikhale zonse zofunikira ngati chipatala, tikufunika kuti HSA akudecho atithandize kuti azikhalirapo mpano, ndipo timangira nyumba, chimbuzi, toilet zosakhala nazo. Ndiye tikupempha kwa decho kuti atipeze HSA kuti azitithandizira konko. Madera athu tikufunisisa kuti tikafikire kuti zaphunzitse ubwino wa champion community, kuti aziwe kuti champion community ndi chani, kuti champion community imatani. Ndeti ndichilakolako kuti siku lina zaphunzitsa kwa asathu kuti atengereko zimene tikuchita.
Apo tikasamukiranga kuno kuti mfumu anayamba ntchito yampanga post ngala kuti nina mwana kale uyo akawa kututuwa chomeni. So ine maganizo ane kuganzange ti mwana ni wakututuwa waka ni thupi lake. Ngazafika kuno mbwe ngasanga chairman wa champion community au akunifumba kuti mwana uyu utenayo kochi kuchipatala. So ine ngati chichi auti mwana uyo oneka kuti osowekera chinthu chinyake mthupi mwake. Mbwenengiza nayo kwa wasimukonda wa hefe, mbwe wasimukonda wakampima mwana yula na kusanga kuti akusowekera chakulya mthupi, chakulya cha magulu 6. Mbwe kuchipatala kula wakamba kunipasa ufu wapo oti nipikenge bara. Mbwe akamba kumwa bara lila kamwanga bara lila makola. Mbwenu ngasanga kuti mwana amba kusinja. Kututuwa kula tutuwanga thupi pala wa mdofya ntembwe likadivukilanga mkati kwa leka. Amba kuizaka thupi la nomo. Mbwe na mulieshapo bara kukwana miezi 6. Mbwe ngasanga kuchipatala kuti mbwenu mwana huyu awasono makola. Uwemi wake unkaonapo ngwa kuti vanivwira mwana woti akanyencheranga vanilimbikisya ine, ndio uwemi wake woti nikuuona kuti mwana wane asintha kufuma ku ulwale wakalwala akanyenchera kuzafika pa stage alipo sono. Yawanja.
Mwandipeza kuno ndi ku headquarters kwa senior group Chimbalanga, muzi mwa Chimbalanga. Chocho ndi muzi umozi umene uli champion community. Ndipo champion community imeneyi yapangapo zinthu zingapo, apangapo koti imene mwandipeza ine muja. Imene ndi koti yanga ya senior group Chimbalanga imene timakumanapo magulu osiyana dera lathu kwa Chimbalanga. Phatikizapo also a champion ndi achagi ngati office yawo sunilo kwaichi. Komanso anakwanisanso kusonkhesa ndalama kumanga CBCC kimene tikuyona kuti komanso amangapo under 5 clinic ili kutundako. Komanso anakwanisa kusonkhesa ndalama ndikagula malo oti yazalapo mitengo ya zipaso kuti cholinga izithakumazimira yokha imene ngati champion community. Ndipo building zimene zikutithandiza choyamba ngati kotija, zikutithandiza ngati office yokumanira napo ngati holo. Yoti tikakhala zochitika mudera la senior group Chimbalanga zokhuza anthu mwina ocheperako mwina pafupi mwina 100 chakuti. Ine ndi Boniface G. Sema, maso ndi senior group vegetable Chimbalanga omwe ndikuang'anira miezi yokwana 16. Under 5 clinic imene ikwathandiza dera lathu lino kukweza na scale amayiso kumakalelerapo kufa anapempha champion community kwa DHO ndipo amabwera nesi pamwezi unauliyonse kuzamayeza amayembekeza pomwepa. Komanso CBCC yawathandizira kwambiri ana adera lathu lino kumaphunzirapo maphunziro amene ampoyamba.
A champion community akhala kudusa mmezi mumemeza anthu kuti aliyense pakhomo pake pakhale zinthu izi zimene zinalizosowa kuno: chimbuzi, thandala, bafa, kitchen, komanso akhale ndi nyumba yabwino, kuonjezeraponso akhale ndi kadimba kapakhomo. Komanso takhala tikufesa mitengo kuti tizathetse vuto la kunyenchera ndi kupinimbira. Masomphenya athu tifuna chipatala chathu chikule chifukwa kwalambulira nkutali. Ndefe timafuna chipatala chathu chitakula kuti china chilichonse chithandizo tizichipezera pati. Komanso timafuna kuti achinyamata athu kuno chithandizo chokhuzana ndi achinyamata azichipezera pafupi. Dzina langa ndine Mwandida Kachinjika, ndine memba wa CHAG. Muzi wanga ndi Chimbalanga, senior group Chimbalanga.
Poyambirira tisanakhale ifeyo kukhala gulu la chiwandira champion community ndiye kuti pamwamba pathu pali achagi amene ndi mamembala 15. Choncho kutabwera bungwe la Onse pokuona malipoti achagi akuno kwa chiwandira chidawakomera iwowo kukhazikitsa kuderako mamembala ena wonjezera pa achagi kuti akhale champion community ngati atachita bwino. Uchokera kwa Onse chithandizo choyamba chimene tachipeza ndiye kuti dziwitse zimenezi za ukhondo kapena kuti za umoyo mmene ufuni kukhalira. Ndipo thandizo lina ndi lakuti kuno kwathu tiona alendo kawirikawiri amene samabwera koma nkhani yake za umoyo kutilimbikitsa. Chimenecho tikachionanso ngati chinthu chofunikira kwambiri chifukwa munthu pamene akhala ndi moyo wamphamvu china chilichonse nchotheka. Dzina langa ndine Thokozani Sungeni, udindo wanga ndine wapampando wa chiwandira champion community. Amene wa abungwe la Onse pamene amalifikira kwakukulu nkhani yake ndi ya zaumoyo. Choncho mu nkhani imene ya zaumoyo muli magawo 4 amene timagwiramo ntchito. Ndiye kuti tili ndi madzi ndi ukhondo komanso kadyedwe koyenera. Wonjezerapo timaonanso za uchembere wabwino ndi kulera. Tikafika ku uchembere wabwino kumeneko molumikizana ndi mafumu tathandizidwa kapena kuti tapanga zinthu zakuti tapeza mayendedwe ndi njinga imene imatha kuti mzimayi akadwala nthawi yake isanakwane timakoka njinga imene jali atakwera pamenepo ndi mayendedwe ya njinga ya moto kupita naye kuchipatala potengera kuti tunda kuchipatala ndi wautali. Ndipo uchembere wabwino monga tafotokozera kale za kuti tinagula njinga komabe amene usima thelo athu timafunabe titapanga china chake choposera pa njingayo kuti mayendedwe asavute kupita kuchipatala. Chimene chasintha kuno kwathu kudera lino pamene Onse amba ubwera kunoko ndikuti poyambirira tili ndi makomo aukhondo zimene madera ena otiyandikira anasilira anayamba kusilira pamene champion akhazikitsidwa kunoko. Kotero kuti ndi zipatso zina zimene ife Onse timawathokoza kuno kwathu kuti kudabwera ukhondo umene kali kunalibe. Ifeyo pakutha zaka 5 timafuna kuno kwathu kutakhala kosinthika kuti mwina tingotengera ngati dowa yonse ino kutakhala chitsanzo kuti koma kwa chiwandira imene tikhazokapezako zina zosowa pa nkhani ya zaumoyo.
Ifa Juma champion tidaganiza zo tandiza chintu chimenechi chifo chimenecho ndi chinthu choti chikhoza omari tandiza ife romwe osada kuboma tikadikirira anthu akuboma ndekuti palibe chimene tingachite chinthu chimene tikuchifuna lero iwo adzathandiza mwina chaka chamawa mwina sosathandiza komweso ayi. Ifa Juma champion chithandizo chomwe tidalandira ku Onse choyambira ndi maphunziro omwe ife a champion tinadzaphunzitsidwa kuno. Chachiwiri tinalandiranso ndalama zokwana 328,500 kwacha. Kuno kwa Ajuma tapangapo skulu yomwe ndi ya CBE ndipo tathandizapo simenti komanso malata. Poyambirira timasonkhana ndalama yokwana 500 kumembala wina aliyense pagulu. Ndipo titasonkha choncho tinayamba business ya safu. Ndipo titachoka pamenepo tinayamba business ya chamwamba. Ndi zomwe zimatipangitsanso kuti tizithandiza azigogo powagulira mchere komanso sopo ndi kuwawachitsira zinthu. Ife ya Juma Community Champion masomphenya athu tikufuna tidzakhale ndi ambulance ya group yathu ino ya Juma. Ncholinga chone kuti ife upangiri wathu uzitha ukukhala unkera patali komanso tizitha kukachirira kuchipatala. Uthenga wanga kwa midzina yomwe yoyandikana kapene ili kwina ndi mudzi wa Juma uno ndikunena kuti asamadikire zithandizo zodikira kuboma chifukwa ifeyo tili ndi kuthekera kwa zinthu zomwe tili nazo konkuno nkuzithandiza mwa ife tokha posadikira munthu wina zomwe zimaonetsa umwini.
Ine ndine Mere Phiri ukhala muzi mwa VH Mlanga Pamalo ndipo mu champion ndine membala pa champion community wakatisambizganga kuti para munthu ava na nthumbo amaya kuti apa mwezi uni ndageze cha ava na nthumbo para yakwana myezi 3 akwenda utatu kuchipatala akayambe skero. So na makatisambizgira wa champion na mfumu wane tikanyamuka tikakamba skero ku St. Anne's pa myezi 3. Na mwaka babikira nilikuyamba naye skero akupokera katemera yose okumbikira wa mwana mpaka kwa sono. Apa mwana sono ana myezi 10 akukura waka makora nosizgo lililonsesha.
Champion yuzikikana mafumu 6 ndiwo kwira ntchito mchikaya ichi.
Ine zina lane nili Esnat Nkhata ngufumira muzi wa Jumbe mwa senior chauteka. Nina vana 4 vana avo ninao ni vana kazipera mwe nkaona va Onse vativiza vasambizya napulika uwemi wao muvakalongosolera kuti kulera ni uwemi upanga vakuti munangulongosolera isona wana uwemi napambanisa zona uheni namo pala nkhalelanga cha leka nine nkatola kulera kuti nikwenda ndoli kulera fa apa nkhalelanga cha business nkapanga yayi natuma bungwe nato nkakhalanga mucha so nkadokeranga kuti kabanyane chifo chauli okhala mtuma bungwe nkamba kulera pa mwana wa nambala 4 ndipo nkamba kulera ina mwana wa sonu na vana vakumasinda napambanisa fa chakuti vana vakumasinda vakapokula kwake vakulanga monyinyirika kweni mwana wa sono inatola pokulera okula mwatanzi ndipo okula mosanguluka mwakupambanisana na vanyake.
Dzina langa ndine Nzari Dango Lejoka mudzi mwampopera ndili babanja maso ndindana araru ndina amene ndalowa nawo gawo la njira zakulera kubaye ka Jackson.
So family planning in Malawi has evolved through a number of approaches that Malawi has put across to curb the access and the quality of services that are provided at all levels. But a number of challenges still remain in terms of women accessing services. So far, Malawi has 58% of women that are married accessing family planning services. But challenges in terms of the number of children that women can have at household level is too high at 4. And the teenage pregnancy has also issued in terms of number of pregnancies that the youth are having at 29%. Because of these challenges, Onse USAID is working with Ministry of Health through the Reproductive Health Directorate to address these challenges. And a number of interventions that Onse is supporting ministry includes access to contraceptives, improving the quality of services in the service delivery points, and also monitoring the uptake of these services in all the 11 districts that Onse is supporting. In 2018, Onse partnered again with the Reproductive Health Directorate through the Polytechnic that conducted a randomized control trial on DMPSC or Cyanapres in Mangochi, where results were favorable that more than 50% of the women that adopt a self-injection were able to continue with this family planning method over a year. So Onse started with 3 districts. That's Kota, Machinga and Salima, where we supported ministry to build capacity of providers that are supposed to train the frontline workers in provision of this DMPSC Cyanapres. Amongst the districts that Onse is supporting, we added in 1 district, Balaka, but over the years, when we supported the review of this program, we noted that there's good uptake of services in Salima. As you all know, Salima, we selected these districts because they are the districts that are hardly hit with low contraceptive prevalence rate, meaning that women are not adopting as much family planning services as possible. So with this support from Onse USAID, we managed to build capacity of providers at all levels, at facility level and community level, to ensure that they're able to provide comprehensive family planning services, including the newly introduced DMPSC or Cyanapres.
I'm a midwife and Cyana trainer. I was trained in DMPA subcutaneous Cyana in Lilongwe. From there, we were able to train others on Cyanapres. After the training, we are also taught to supervise the providers we have trained. On the competency list, we follow infection prevention measures if the provider is able to follow that. If he is able to explain to the client how to activate or to do the safe injection of Cyanapres. And also we supervise them on how they do the injections. That is, we call it provider injection.
Ine ndimavira ku sukulu kuja ngati wa mother group ndimakaphunzitsa atsikana kuti pamene akuphunzira sukulu nkutheka kuti akhoza mapanga dzibwezi ndi azitenga njira yakulera yakudzibaya wekha. Ndiye ndimathandizira atsikana aja moti atsikana ambiri atenga ndithu njira imene yakudzithandizira. Ngakhale so amene adasiya m'mudzimu, amene adasiya kale sukulu kaya adachimwitsidwako poyamba, ndimakalimbikitsanso ngati chali chikuja ndimakalankhula kaya ninkumano wina uliwonse ndimatha kalankhula kwa auza atsikana kwa alimbikitsa kuti azitengabe njira imeneyi kuti adzapitirizenso sukulu patsogolo pano.
Jackson ozibayeka ndinamudziwira kwa zomoyo alangizi amaluwa. Ndipamene ndipatsa ndikundiphathulira kundilangiza kuna kuti Jackson ozibayeka ndamene. Jackson ndakhala ndikugwiritsa ntchito mwa zaka zitatu. Ndipo Jackson wake ubwino wake sindimasamba naye pakana kudwala sana ayi. Oti Jackson imene ndi wamphamvu kwambiri oti amandithandiza inewo.
Ona bwa usikelo dabaitsa mwana boso ndabwaro ndidzerenge kulera ndendilapita kujipinda mavange kulera ndabva kwa malangiza ngabo zinthu zokulera nene ndasankhanyirese ana kuti ndidzika zibende kamlingana task force imene makabayira anthu kutali ndene sankhanyire imene kuti dzizizerethu thupilanga ndibosona anga adzikula mwathazi.
Komeza Health Center ndi chipatala chimodzi chimene chili chachikulu kunoko kusalima chimene timapereka ma services osiyanasiyana kwa ma clients athu. Timapereka njira za kulera, timapereka thandizo la COPD, ndiyeno pa njira za kulera za family planning pali njira zosiyanasiyana zimene timapereka panopa pakhombedza. Imodzi mwa njira imene tikulimbikitsa masiku ano imene inabwera ndi Jackson iyo ndi njira imene tinaphunzitsidwa kuti zipereka kwa ma clients athu akabwera kunoko timatha kuwabaya komanso amatha kukhala ndi ufulu ozibaya okha tikaphunzitsa. Njira imene iyi ili ndi ndondomeko zake zimene munthu akamazibaya amayenera kutsatira. Timamufotokozera momveka bwinobwino komanso pa njira za kulerazi timalimbikitsa kuti zimayi akamabwera kunoko ku chipatala kuyenera kubwera limodzi ndi mamuna wake chifukwa akabwera limodzi amazamvera limodzi uphungu.
So as we speak, Salima is amongst the districts that is performing well in terms of uptake of family planning service for this DMPS Sayana Press, ensuring that clients are able to self-inject. So because of also the coronavirus pandemic, the DMPS Sayana Press has ensured that women don't come to the hospital often, and they also reduce congestion at the facility level. So women are able to take this commodity for 1 year, for 6 months or for 9 months whilst they are at home without returning to the facility.
Bwino wake sindipita kuchipatala kuti ndikabaitsa jekeseni chifukwa ndimopa COVID-19. Ubwino winaso ndiona kuti umakhala kwa pakhomo umagwira ntchito za pakhomo chifukwa choti ukapita kuchipatala kuti ndikabaitsa jekeseni umaononga matransport ndipo pamene ndalama ulibe kuti ukabaitsa jekeseni unde pamene umakhala umangokhala pakhomo.
So as Onse, that's our wish to ensure that the minister are able now to take this and run with it and are able now to provide these services in all the service delivery points.
As a champion community, tinachiona kuti tili ndi mavuto akuti kuno kudera kwathu kwa Chakupomba, tinakhala pansi nikuganizira ndikulingalira kuti vuto lathu ili monga mavuto tinapeza atatu. Pa mavuto atatu imene nakula kwambiri ndikudwala kwa ana ndi malume. Zina langa ndine Clayton Steve Chingaliwa. Zina la gulu lathu ndi Chakupomba Champion Community. Ni Champion Community monde ne secretary. Chomwe chinatipangisa kuti tipange chitukuko chimenechi ndi mavuto amene timakumana nawo aja tinanena kuti ndi mavuto atatu mdera mwathu muno. Kudwala kwa ana under 5 komanso malaria ingani ya nutrition. Champion Community azimayi amakumana ndi mavuto kuti akachoka kunyumba kwawo kuti azipita ku health center imene yochuluka makilomita 7 amaberekera njira kukafika kuchipatala atabereka kale mchiro. Vuto limene linatikuza kwambiri ngati za Champion Community. Ndiye tinakhala pansi ndikupanga chiganizo choti timange clinic. Chimene chinatipangisa mavuto amene. Kale zinthu zimakhala zovutirapo poti chipatala chinali kutali kwambiri. Koma pano tikuona kuti zinthu zikuyenda poti chipatala tamanga ma service onse timalandira pompa. IHSA athu amachoka kuchipatala kuja kutali kubwera pano zati kosa ma service onse. Ndiye zimationesa kuti pano tayombako kuti moyo wathu uli bwino kwambiri. Zinthu zasintha kusiyana ndi kale. Budget yathu ngati community imene tinagwirizana kuti timange clinic inali ya 3 million. Ndiye ndalama zimene zinazipezera njira zitanena kuti tinasegula matimba. Kenako tinapemba achibara imene ku South Africa kudera konkuno anathandizanso ndalama yokwana 600,000. Masomphenya athu ngati Champion Community tikufunitsitsa kuti chipatala chimene chikhale zonse zofunikira ngati chipatala tikufunika kuti HSA akudechwa atithandize kuti azikhalira pompano ndipo timangira nyumba chimbuzi toilet zosakhala nazo. Ndiye tikupempha kwa decho kuti atipeze HSA kuti azitithandizira konko. Kumadera athu tikufunisisa kuti tikafikire kuti zaphunzitse ubwino wa champion community kuti aziwe kuti champion community ndi chani, kuti champion community imatani. Ndeti ndichilakolako kuti siku lina zaphunzitsa kwa athu kuti atengereko zimene tikuchita.
Apo tikasamukiranga kuno kuti mfumu anayamba ntchito wampanga post ngala kuti nina mwana kale uyo akawa kututuwa chomene. So ine maganizo ane kuganzange eti mwana ni wakututuwa waka ni thupi lake. Ngazafika kuno mbwe ngasanga chairman wa champion community au akunifumba kuti mwana uyu utenayo kochi kuchipatala. So ine ngati chichi auti mwana uyo oneka kuti osowekera chinthu chinyake mthupi mwake. Mbwene ngizanayo kwa wasimukonde wa hefe, mbwe wasimukonde wakampima mwana yula na kusanga kuti hakusowekera chakulya mthupi, chakulya cha magulu 6. Mbwe kuchipatala kula wakamba kunipasa ufu wapo oti nipikenge bara. Mbwe akamba kumwa bara lila akamwanga bara lila makola. Mbwenu ngasanga kuti mwana amba kusinja. Kututuwa kula tutuwanga thupi pala wa mdofya ntembwe likadivukilanga mkati kwa leka. Amba kuizaka thupi la nomo. Mbwena mulieshapo bara kukwa na miezi 6. Mbwe ngasanga kuchipatala kuti mbwenu mwana huyu awasono makola. Uwemi wake unkaonapo ngwa kuti vanivwira mwana oti akanyencheranga vanilimbikisya ine ndio uwemi wake oti nikuuona kuti mwana wane asintha kufuma ku ulwale wakalwala akanyenchera kuzafika pa stage ya alipo sono. Yela yawanja yawahani ng'ombe.
Mwandipeza kuno ndi ku headquarters kwa senior group Chimbalanga, muzi mwa Chimbalanga. Chocho ndi muzi umozi umene uli champion community. Ndipo champion community imeneyi yapangapo zinthu zingapo, amangapo koti imene mwandipeza inu muja. Imene ndi koti yanga ya senior group Chimbalanga imene timakumanapo magulu osiyana dera lathu kwa Chimbalanga. Phatikizapo so a champion ndi achagi ndi office yawo sunilo kwaichi. Komaso anakwanisaso kusonkhesa ndalama kumanga CBCC kimene tikuchona kukokoji. Komaso amangapo under 5 clinic ili kutundako. Komaso anakwanisa kusonkhesa ndalama ndikagula malo oti yazalapo mitengo ya zipaso kuti cholinga izithakumazimira yokamene ngati champion community. Ipa building zimene zikutithandiza choyamba ngati kotija, zikutithandiza ngati office yokumania napo ngati holo. Yoti tikakhandizo chitika mudera la senior group Chimbalanga zokhuza anthu mwina ocheperako mwina pafupi mwina 100 chakuti. Ine ndi Boniface G. Sema, komanso ndi senior group village chairman Chimbalanga, omwe ndikuang'anira miezi yokwana 16. Under 5 clinic imene ikwathandiza dera lathu lino kukweza na sikelo amayiso kumakalelerapo kufa anapempha champion community kwa DHO. Ndipo amabwera nesi pamwezi unauliyonse kuzamayeza amayembekeza pomwepa. Komanso CBCC yawathandizira kwambiri ana adera lathu lino kumaphunzirapo maphunziro amene mpoyamba.
A champion community akhala kudusa mmezi mumemeza anthu kuti aliyense pakhomo pake pakhale zinthu izi zimene zinalizosowa kuno: chimbuzi, thandala, bafa, kitchen, komanso akhale ndi nyumba yabwino kuonjezeraponso akhale ndi kadimba kapakhomo komanso takhala tikufesa mitengo kuti tizathetse kusogolo vuto la kunyenchera ndi kupinimbira. Masomphenya athu tifuna chipatala chathu chikule chifukwa kwalambulira nkutali ndefe timafuna chipatala chathu chitakula kuti chine chilichonse chithandizo tizichipezera pati komanso timafuna kuti achinyamata athu kuno chithandizo chokhuzana ndi achinyamata azichipezera pafupi. Dzina langa ndine Mwandida Kachinjika, ndine memba wa Chagi, muzi wanga ndi Shimbalanga, senior group Shimbalanga.
Oyambirira tisanakhale ifeyo kukhala gulu la Chiwandira Champion Community ndiye kuti pamwamba pathu pali achagi amene ndi mamembala 15. Choncho kutabwera bungwe la Onse pokuona malipoti achagi akuno kwa Chiwandira chidawakomera iwowo kukhazikitsa kuderako mamembala ena wonjezera pa achagi kuti akhale champion community ngati atachita bwino. Uchokera kwa Onse chithandizo choyamba chimene tachipeza ndiye kuti dziwitse zimenezi za ukhondo kapena kuti za umoyo mmene ufuni kukhalira, ndipo thandizo lina ndi lakuti kuno kwathu tiona alendo kawirikawiri amene samabwera koma nkhani yake za umoyo kutilimbikitsa chimenecho tikachionanso ngati chinthu chofunikira kwambiri chifukwa munthu pamene akhala ndi moyo wamphamvu china chilichonse nchotheka. Dzina langa ndine Thokozani Sungeni, udindo wanga ndine wapampando wa Chiwandira Champion Community. Amene wa abungwe la Onse pamene amalifikira kwakukulu nkhani yake ndi ya zaumoyo. Choncho mu nkhani imene ya zaumoyo muli magawo 4 amene timagwiramo ntchito. Ndiye kuti tili ndi madzi ndi ukhondo komanso kadyedwe koyenera, wonjezerapo timaonanso za uchembere wabwino ndi kulera. Tikafika ku uchembere wabwino kumeneko molumikizana ndi mafumu tathandizidwa kapena kuti tapanga zinthu zakuti tapeza mayendedwe ndi njinga imene imatha kuti mzimayi akadwala nthawi yake isanakwane timakoka njinga imene jayi atakwera pamenepo ndi mayendedwe ya njinga ya moto kupita naye kuchipatala potengera kuti tunda kuchipatala ndi wautali. Ndipo uchembere wabwino monga tafotokozera kale za kuti tinagula njinga komabe amene usima thelo athu timafuna be titapanga china chake choposera pa njingayo kuti mayendedwe asavute kupita kuchipatala. Chimene chasintha kuno kwathu kudera lino pamene Onse amba ubwera kunoko ndikuti poyambirira tili ndi makomo aukhondo zimene madera ena otiyandikira anayamba kusilira pamene champion akhazikitsidwa kunoko, kotero kuti ndi zipatso zina zimene ife Onse timawathokoza kuno kwathu kuti kudabwera ukhondo umene kali kunalibe. Ifeyo pakutha zaka 5 timafuna kuno kwathu kutakhala kosinthika koti mwina tingotengera ngati dowa yonse ino kutakhala chitsanzo kuti koma kwa Chiwandira imene tikhazo kapezako zina zosowa pa nkhani za umoyo.
Ifa Juma Champion tidaganiza zothandiza chinthu chimenechi chifukwa chimenecho ndi chinthu choti chikhoza kumatithandiza ife romwe osati kuboma. Tikadikirira anthu akuboma ndiye kuti palibe chimene tingachite. Chinthu chimene tikuchifuna lero iwo adzathandiza mwina chaka chamawa mwina osathandiza komwenso ayi. Ifa Juma Champion chithandizo chomwe tidalandira ku Onse choyambira ndi maphunziro omwe ife a champion tinadzaphunzitsidwa kuno. Chachiwiri tinalandiranso ndalama zokwana 328,500 kwacha. Kuno kwa Ajuma tapangapo skulu yomwe ndi ya CBE ndipo tathandizapo simenti komanso malata. Poyambilira timasonkhana ndrama yokwana 500 kumembala wina aliyense pagulu. Ndipo titasonkha choncho tinayamba business ya safu. Ndipo titachoka pamenepo tinayamba business ya chamwamba. Ndi zomwe zimatipangitsanso kuti tizithandiza azigogo powagulira mchere komanso sopo ndi kuwawakitsira zinthu. Ife ya Juma Community Champion masomphenya athu tikufuna tidzakhale ndi ambulance ya group yathu ino ya Juma. Ncholinga chonde kuti ife upangiri wathu uzitha ukukhala unkera patali komanso tizitha kukachilira kuchipatala. Uthenga wanga kwa midzina yomwe yoyandikana kapena ili kwina ndi mudzi wa Juma uno ndikunena kuti asamadikire zithandizo zodikira kuboma, chifukwa ifeyo tili ndi kuthekera kwa zinthu zomwe tili nazo konkuno nkuzithandiza mwa ife tokha posadikira munthu wina, zomwe zimaonetsa umwini.
Ine ndine Mere Phiri ukhala muzi mwa VH Mlanga Pamalo ndipo mu champion ndine membala pa champion community wakatisambizganga kuti para munthu ava na nthumbo amaya kuti apa mwezi uni ndageze cha ava na nthumbo para yakwana myezi 3 akwenda utatu kuchipatala akayambe skero. So na makatisambizgira wa champion na mfumu wane tikanyamuka tikakamba skero ku St. Anne's pa myezi 3. Na mwaka babikira nilikuyamba naye skero akupokera katemera yose okumbikira wa mwana mpaka kwa sono. Apa mwana sono ana myezi 10 akukura waka makora nosizgo lililosesha.
Champion ikuzikikala mafumu 6 ndiwo kugwira ntchito mchikaya ichi.
Ine zina lane nili Esnat Nkhata ngufumira muzi wa Jumbe mwa senior chauteka. Nina vana 4 vana avo ninao ni vana kazipera mwe nkaona ava onse vativiza vasambi ngosolera kuti kulera ni uwemi upanga vako tumunangulo ngosolera isona wana uwemi napambanisa zona uheni namo para nkhalelanga cha ndekanine nkatola kulera kuti ndikwenda ndoli kulera fa apo nkhalelanga cha business nkapanga yayi natuma bungwe nato nkakhalanga mucha so nkadokera kuti kabanyane chifo cha uli okhala mtuma bungwe nkamba kulera pa mwana wa nambala 4 ndipo nkamba kulera ina mwana wa sonu na vana vakumasinda napambanisa facha kuti vana vakumasinda vakapokula kwake vakulanga monyinyirika kweni mwana wa sonu inatola pokulera okula mwatanzi ndipo okula simosanguluka mwakupambanisana na vanyake.
Zinanga ndine Nzarika Dango pejoka mudzi mwa Mpopera ndili babanja komanso ndinda ana atatu ndine amene ndalowa nawo gawo la njira zakulera kubaye ka Jackson.
So family planning in Malawi has evolved through a number of approaches that Malawi has put across to curb the access and the quality of services that are provided at all levels. But a number of challenges still remain in terms of women accessing services. So far, Malawi has 58% of women that are married accessing family planning services. but challenges in terms of the number of children that women can have at household level is too high at 4. And the teenage pregnancy has also issued in terms of number of pregnancies that the youth are having at 29%. Because of these challenges, Onse USAID is working with Ministry of Health through the Reproductive Health Directorate to address these challenges. And a number of interventions that Onse is supporting ministry includes access to contraceptives, improving the quality of services in the service delivery points, and also monitoring the uptake of these services in all the 11 districts that Onse is supporting. In 2018, Onse partnered again with the Reproductive Health Directorate through the Polytechnic that conducted a randomized control trial on DMPSC or Sayana Press in Mangochi, where results were favorable that more than 50% of the women that adopt a self-injection were able to continue with this family planning method over a year. So Onse started with 3 districts. That's Kota, Machinga and Salima, where we supported ministry to build capacity of providers that were supposed to train the frontline workers in provision of this DMPSC Sayana Press. Amongst the districts that Onse is supporting, we added in 1 district, Balaka, but over the years, when we supported the review of this program, we noted that there is good uptake of services in Salima. As you all know, Salima, we selected these districts because they are the districts that are hardly hit with low contraceptive prevalence rate, meaning that women are not adopting as much family planning services as possible. So with this support from Onse USAID, we managed to build capacity of providers at all levels, at facility level and community level, to ensure that they're able to provide comprehensive family planning services, including the newly introduced DMPSC or Sayana Press.
I'm Onse, I'm a midwife and Sayana trainer. I was trained in DMPA subcutaneous Sayana in Lilongwe. From there, we were able to train others on Sayana Press. After the training, we are also told to supervise the providers we have trained. On the competency list, we follow infection prevention measures if the provider is able to follow that. If he is able to explain to the client how to activate or to do the safe injection of Sayana Press. And also we supervise them on how they do the injections, that is, we call it provider injection.
Ine ndimavira kusukulu kuja ngati wa mother group ndimakaphunzitsa atsikana kuti pamene akuphunzira sukulu nkutheka kuti akhoza mapanga dzibwezi ndi azitenga njira yakulera yakudzibaya wekha. Ndiye ndimathandizira atsikana aja moti atsikana ambiri atenga ndithu njira imene yakudzithandizira. Ngakhale so amene adasiya m'mudzimu, amene adasiya kale sukulu kaya adachimwitsidwako poyamba, ndimakalimbikitsanso ngati chali chikuja ndimakalankhula kaya nikumano wina uliwonse ndimatha kalankhula kwa auza atsikana kwa alimbikitsa kuti azitengabe njira imeneyi kuti adzapitirizenso sukulu patsogolo pano.
Jekese zibayeka ndinamudziwira kwa zomoyo alangizi amaluwa. Ndipamene ndibatsa ndikundiphathulira kundilangiza
Abanja kujiteke malawi chimafuna wangu osagara kutisi teke titenge bombani malawi olimpiki sana kaiza umoyo barisa kulezo anukonga kare kansa mizia tasturikira Kumiti kumusa Tiri udin nofea Utanga tirabo Malawi Upanirita Kaniza umoyo Give me
Check, 1, 2. Okay, thank you. Check 1, 2. Check 1, 2. Check 1, 2. Check 1, 2. Okay, thank you so much, ladies and gentlemen, and welcome back. It looks like we overindulged on the health break, so we'll see how we can make up for lost time. Although they say time lost can never be recovered, so we'll dive right into it. Let me welcome you back, Honorable Deputy Minister of Health, Honorable Enoch Pale, and all distinguished guests, ladies and gentlemen. Welcome to the second and last session of this conference, where we are now going to have some presentations to get to appreciate more about the project that is being phased out today. First will be an overview of Onse implementation and interventions and achievements, and this is a presentation which is going to be done by Dr. Ann Poya, who is the Onse Chief of Party. Let me invite her to come forward and make her presentation now.
Good morning once again, ladies and gentlemen. I recognize the presence of the Deputy Honorable Minister, the Secretary for Health, Lily from the Mission, and the Vice President Dana from MSH. I will try to be as quick as possible, as the Director of Sermon has already reminded us that we've lost some time, but I will try to do the best that I can. The overview of the presentation is just to share with the team on what the project has done. I know most of it has already been presented, but nevertheless, people say the devil is always in the detail, so I will try to give the details on what the project has achieved. So we are going to look at accomplishments made in the access to essential services, health systems strengthening, and we will end up with the demand creation, including lessons and the recommendations that the project is making this morning. We already heard that this project was 6 years, and it was looking at improving maternal and child health. Key research areas or strategic objectives included improving access to priority health services, improving the quality of health services, strengthening health system performance, and to increase demand for those services. To make sure that the project was implemented in an orderly manner, the project was following values and principles. We looked at issues of dignity for the clients who access the care, but also the providers of the care and the other actors in the system. We also looked at the issue of accountability between the health system and the communities that they serve. But we are mindful of implementing interventions that have evidence backing with them by using data to design, look at the targets, and also to set priorities. But we also believed in systemic capacity building, because for us to provide those services, we needed to have capacity, one, to sustain, and to make sure that the providers, the health workers, are competent enough. So let's look at the focus at the district level. The colors depict, if you look at the map, they depict what services were given. To start with, this project was in 16 districts across the 3 regions of Malawi, Up north, we had Chitipa, Karonga, and Nkatabe. In the central region, we had Kasungu, Nkota, Dowa, Salima, Lilongwe, Mchinji, and Nchewu. In the southern region, we had Mangochi, Machinga, Balaka, Zomba, Mulanje, and Chikwawa. In terms of the package of services, the districts were not equal, or they were not the same. Let me not use the word equal, but the same. If you look at the map, the red color shows districts that were earmarked for malaria. So there were some districts that were called malaria districts. So the malaria districts included Chitip, included Nkatabe in the north, Mchinji in the central region, Nchewu in the central region, Mangochi in the south, and Chikwawa in the south. So those received comprehensive management of malaria, including health systems strengthening. Then we had a package of services for districts that were called family health districts. And the family health package included maternal, neonatal, and child health, including family planning, sexual reproductive health services, health systems strengthening, nutrition, WASH, and I've already mentioned the family planning. Then we had the districts that were named the full package. So as the word says full, they received everything. That includes the issues of the malaria and as well as the family health package. And I know that the differentiation caused some concern somewhere in the districts, but this is how the project was designed. I wished we had in the map included another color to provide for COVID, because COVID was in all the 16 districts, so I want you to take note of that. So the types of support, for easy understanding of our interventions, we termed them software, and the software included the capacity building, this is the training, the supervision, service delivery, issues of quality of care, systems strengthening, and bringing new services, new models so that they can be upscaled. For the hardware component, we looked at the provision of equipment, but also supporting infrastructure development, vehicle maintenance, but also provision of fuel. There was a time when we had severe blackouts in the country, so Onse provided fuel for the genses, but also to run the district fleet. Onse had seen its share of emergencies. During the 6 years, Malawi was facing challenges of COVID, cholera, cyclones. So we supported the districts to manage these challenges. Included was also the storage of vaccines after Mangochi storage was caught in fire. But also with the cyclone Idai, a health facility in Chikwawa lost its roof. The maternity was bare, and the Onse went there for rescue. And then, of course, we also supported the policy development of certain projects, activities in the Ministry of Health. So now I will just take you quickly to access and quality essential health services. What has the project improved? As a project that was based on the evidence that is on the ground, we started the project with a baseline to see what was the situation. And then, of course, at the end of the project, we also did a baseline, another endline survey to see whether we have improved anything. So I'm happy to report that at the time when we started, the facilities that we were going to that were in the districts, we noticed that only 74% were providing child health services. With the Onse support, we have gone to 100%. Family planning was at 82%, we are now at 100%. MNH was at 54, now we are at 90. Malaria was at 96, now we are at 100. Kangaroo mother care was only at 63 and we are at 67. This has become a challenge simply because of provisions of space in the maternity wards. So people just use probably a small corner somewhere where a mother and her family can do kangaroo care. In terms of access to care, apart from the figures that I have given you, the details include support to the district teams to run outreach or mobile clinics. So through the project, we have supported more than 10,000 outreach clinics where more than 2,000 people access the services such as immunization, MCH, such as antenatal, postnatal, family planning, HIV testing and counseling, nutrition counseling, malaria diagnosis and treatment, and also other general ailments, because when you go to an outreach, everything comes to that clinic. At maternity level, this morning we saw how the health providers were managing issues of PPH, but to prevent PPH, we supported the districts to make sure that women that come for delivery are receiving uterotonics to prevent hemorrhage. So more than 1 million people, women, have received uterotonics during delivery. We also supported the early initiation of antenatal care, and this more than 200 women have started antenatal in the first trimester. The issue of resuscitation was already mentioned. 40,000 neonates were resuscitated who had a challenge to breathe at birth. For family planning, we have generated more than 3 million CYPs, and those of us that do statistical models can tell us these CYPs would tend to how many maternal deaths that have been averted. Continuing on access, issues of transport are an issue in the community. So communities like the community we saw at Chiwandira, they have established community transport so that they can transport women that need advanced care. We also supported village clinics where more than 2,460 providers were trained so that they can manage their village clinics properly. Through these clinics, children suffering from diarrhea and pneumonia were treated at the community level, of course, including children that have been immunized to complete their DPT-3. For family planning, we just want to add that Onse also played along other partners to support the ministry to roll out Depo-Provera, Sayana. This is the injectable contraceptives that women can inject themselves. So we supported the reproductive health unit to roll out this program. Specifically, we oriented and sensitized DHMT, DEC, ADCs in Machinga, Kota, and Salima district. This also included the training of the service providers. This is the HSAs and the nurse midwives, so that they can work with the women, teach them how to inject themselves. So this has gone on like that. As a project that was interested in generating evidence, part of the implementation was to see what can we do to improve uptake of IPTP during pregnancy. So we had a randomized study in Kadabe and Nchewu, where HSAs were going in the communities, teaching the women about IPT, and also distributing at the community level, and encouraging the women to come to the clinic to start prenatal early. So the results of the study are showing indeed that if we do this approach, we can increase the number of women that take more doses of IPTP, but also encourages women to start antenatal care early. That's why earlier on I did mention that a number of women started prenatal care early, which is one of the issues that Malawi is struggling with, to make sure that women come for prenatal service early. Issues of WASH also supported access to care. So it was already mentioned that some health centers in Malawi were provided with running water, but the systems were, the boreholes were broken, the pipes in the walls were not working. So Onse went in and rehabilitated all these broken pipes. I have an example of Lifu. Is DHO Salima here? DHO Salima, are you here? Lifu is one of the health centers that was provided for with the running water, but it wasn't working because all the pipes and whatnot were broken. So we rehabilitated Lifu. As of now, all the pipes are working, the water is running. But we also drilled boreholes in the facilities because it is really bad to have a facility that does not have running water. Especially on my side as a midwife, it is challenging to go to a labor ward that doesn't have water. So we managed to do this in some facilities. Like I did mention earlier on when I was doing the brief introduction at the beginning, good health does not start in the facility. Good health starts at home. That's why we went to the community to support rehabilitation of boreholes so that safe water is available at home. But to make sure that the boreholes that were rehabilitated are well taken care of, we built capacity of water point committees so that they should be taking care of these facilities. We have the women from Mulanje, from Kanyizira village. Azumaya kwa Kanyizira, are you still here? Azumaya omanga zimbuzi aje. Okay. In Mulanje, we trained women to be masons to construct improved latrines. I was very impressed when I visited this community to see that the women were ahead of the game, supporting their communities to have improved latrines. And a total of 2,654 latrines have been built at the community level by the community members themselves. Through this initiative, 80 traditional authorities have been declared open defecation-free areas, and we have brought one chief from Lilongwe here to give a testimony. To support this, we also trained 251 area mechanics who can now support maintaining the boreholes that we have built at community level. I mentioned about incinerators, 12 of them in our facilities. DHO Karonga, are you here? Please wave your hand. He's the beneficiary of some of these facilities that I've mentioned. I was talking about the women who are building latrines. As Maya Chitukukwajandamen Aimapo, let's give them a hand. Thank you, Azmaika Karen. These women are coming from Kanyizira village in Mulanje. They are the ones that are constructing VIP latrines. So if you want some support in your village, please take their contact numbers. They will assist you. In the health centers where we could not put a mechanical incinerator, we went and built the mortar and brick incinerators, including placenta pits and what have you. Renovation was also one of our commitments. Firstly, family planning is an issue in Malawi, so we supported the districts to have family planning clinics, official clinics. So some of the offices that Onse was using as their office space have been rehabilitated or remodeled to function as a family planning clinic. These clinics are in Chitipa. Chitipa, are you here? Yeah, those guys have a good family planning clinic. Dowa, are you here? Dowa has also a prefab family planning clinic. All of them, Bwaira has the biggest one because Bwaira was specifically built as a family planning clinic. Bwaira, are you here? Okay. Yeah, so those are some of the things that I just wanted to share. I did mention about Onse being responsive to emergencies. During Cyclone Idai, Chapananga lost its roof and the Onse rehabilitated it. DHSS Chikwawa, are you here? Is Chapananga still standing? Good. Okay, and the electrification, Machinga Health Center had no power for a long time, so we went and removed all the electrical wires and replaced them. Now it is functioning properly, including Nkatabe, the new private ward. Nkatabe DHO, are you here? We electrified the new facility so that it can now function properly as a proper ward. We also supported the provision of equipment to support child health, including maternal health. I will not go through all the equipments that we provided, but the testimony is there. Can we see the, there was in the presentation, I have a slide that has the PS here, receiving the equipment from the then Ambassador Palmer, who received the equipment on behalf of, who handed the equipment to the PS on behalf of Malawi government. But we have provided a lot of equipment for MNH. Now let me go to COVID. COVID brought a lot of challenges to all of us, and we needed to support the health system to cope. So one of the areas that we have supported for COVID is to make sure that the vaccination in the district was doing well. So we supported our districts to do immunizations. 3 districts, Blantyre, Zomba, and Lilongwe. In addition to the regular immunization, we had also a campaign during the Christmas time in 2021 and spilling to January of 2022. And through those exercises, Onse has contributed to 57% of Malawians that are vaccinated. That was Onse support. In terms of contact tracing, you know, part of the surveillance is to do contact tracing. So we supported the districts to do contact tracing. More than 73,000 people were traced through Onse support. We needed to train the health workers to work either in the ETUs or to vaccinate or to do risk communication. So more than 1,000 health workers were trained to participate specifically in the vaccinations. I've already mentioned about risk communication. Apart from going out with mobile vans and whatnot, we also supported messaging through the radio. For example, Radio Tuntufi up north was supported, and that was really a good plan because it was not only the messages were not only going to Chitipa and Nkatabe as the Onse district, but the whole northern region received these messages that went through the radio. And Mulanje and Zomba and Salima, they also have community radios that were supported to provide messages. So the list of people that you see that received this support was also through the radio messaging. Let me quickly go to health systems strengthening, where we supported governance for health service delivery. Firstly, we supported the district teams to either plan or review their DIPs. So far we have supported 239 DIP review sessions within the 6 years, but we also revamped health center management committees so that they should know what they need to do. 339 of them were revamped. Supportive supervision is critical through the ComCare platform. The DHMTs supportive supervision in 75% of their facilities using the ComCare. But we also supported health information system, because without information, the Ministry of Health would not know whether we are making progress or not. So we supported the health centers to make sure that their LMIs, this is the Logistic Management Information System, is functional for people to trace whether medicines are available, what is not available, what drugs, including supportive supervision itself, so that we should see whether facilities are providing services. And when a supervision team went, if they made recommendations through the ComCare application, they were able to follow whether the districts are implementing recommended action plans. I would like now to mention about smart capacity building. Before I go to the actual smart capacity building, part of the systems strengthening that Onse did was the shortage of health workers, where some health facilities were really threatening to close because they didn't have health workers. So Onse came through to support relief allowances for 607 short-staffed facilities by giving relief allowances to 628 health workers that included medical assistants, clinicians, nurses, including anesthetists in the CIMUC facilities where we needed to do cesarean sections in a timely manner. For smart capacity building, what we really mean here is to move away from the classroom learning so that we don't create unnecessary shortages of staff. So Onse championed with other partners that we should be doing the low dose, high frequency trainings within the settings so that people can be up to speed with their skills for MNH. So through this smart capacity building, a large number of health workers have been trained. For example, 362 health workers have been trained on kangaroo care to manage children that are born preterm. For malaria, more than 2,779 people were also trained on how to manage, how to test, and how to follow up malaria treatment. In terms of quality improvement, we worked with the QMD and the districts in setting up the quality improvement management or governance structures that we call the KISS and the WISC, so that they can be looking at issues of quality improvement. I think we saw some of the presentation area on. So these management structures currently are implementing quality improvement projects, looking at different areas of health service delivery. As usual, I like to give examples from the maternity. I know one team was looking at how we are monitoring using the patograph. Others are looking at issues of neonatal care. Just to mention a few, I know that one of the champions for KIST is here, DNMO Karonga. You want to raise your hand as a champion for quality improvement? Great. Now let me go to demand creation. This was also one of the critical components because we really wanted the community to be part and parcel of the team that is implementing Onse at the community level. Like I said, I'm a strong believer that good health starts at home, not in the facility. So we managed to support establishment of champion communities, including community health action groups. We saw one champion community today showing us what they do. And currently 60% of the communities in the districts are using community scorecards to look at how services are being provided in their areas. Part of demand creation was that Onse supported Chipatala Chapa phone so that people out there can come in with their questions on the phone and get information. So out of the support to Chipatala Chapa phone, about 1,000 calls were made seeking for information on what to do when they are at home. We were also part and parcel of the partners that supported the functionality of the center for Chipatala Chapa phone at Bwaira. To do all this, it was mentioned already by the Director of Policy and Planning in the ministry that Onse was a complex project. And as a team, we also believed that one man cannot fight a dozen. So we had guarantees that we are working with us to support a number of initiatives for the project. So we had engaged partners that we called guarantees to support us with the issues of, let's say, for example, demand creation and the creating of awareness for malaria in the districts. We also used the same facility for WASH. Remember I mentioned about rehab of those 200-something boreholes. We contracted Strathclyde University and their team to do that rehab. So we really worked with a number of partners to do a number of things. If I'm not mistaken, I think Mehen at one time was also one of our guarantees. Mehen, we are here, right? Yeah, so Onse worked with a number of partners to achieve its work, including demand creation for Onse. So basically, this is what I wanted to share with you before I go to the lessons learned. So what are the lessons that we have learned in the 6 years? One, we need to make sure that the beneficiaries of the project, like DHMTs, need to be continuously advised on the boundaries for the project. You know, there's no project that can do everything. So we need to be advising each other that this project can only do 1, 2, 3, but it cannot do 10 or 11. So this is what we experienced, that sometimes the HMTs were asking for things that we were not able to do. But we know that what they were asking for were genuine things, because the health system requires a lot of things. But as a project, we could not do everything. Earlier on, when I started the presentation, I showed you the differences in the packages, like we had a malaria, family health, and full package. Some districts, especially the malaria districts, were really very unhappy. Why were they only given malaria? Because they also had challenges of MNH. So probably future projects should look at that. Smart capacity building as a new initiative, we had a little bit of resistance because people liked the classroom setting, a week or so in class, but we said we cannot manage to do that because we have critical shortages of staff. So we had a little bit of challenges, but I think people are picking up. One of the lessons we noticed that it is essential to harmonize allowances between partners, because if you have partner B paying $1, partner C paying $2, already you are creating confusion at the implementation level. So as partners, let's make sure that we work in harmony, because if we have competing allowances, then other activities are not done. It's human nature to go for the best. Yeah? We also noticed that policymakers, especially at the district level, they appreciate more hardware investments, because we can train and train and train, but if they have a broken hospital, they have broken equipment, it doesn't play very well. We also noticed that working through the hospital staff, like the maintenance officer from Lilongwe DHO was explaining that we worked through the artisans, the PAM staff at district level to do most of the construction work. We noticed that one, we saved a lot of money, but secondly, we have built capacity and ownership of these facilities. And the last lesson that I would like to share with you is that we noticed that as a complex project, probably an advisory committee would have been more helpful than just to rely on focal persons. So probably in future, the ministry and the districts may wish to think through setting up an advisory committee for big projects that may come in future. So what are the recommendations that we would want to leave on the floor? One, community involvement is critical. So we need to make sure that future projects increase community involvement so that uptake of services can be increased. We need to advocate for accountability of health workers so that the communities' needs are responded to in a timely manner. We are also thinking, if a ministry can think through, that if possible, we need to put in a little bit of money in the health centers, management teams, so that they can also pay for some services that they do for themselves. We need to invest more on prevention so that people at the community can assist us to prevent some of the illnesses that come to our facilities. I've already mentioned about the catalytic investment for health center management teams. We noticed the team that came from Chinji that we had built an under 5 shelter. If they had a little bit of money, they can do more. So that's what we are looking at that. And lastly, but not least, we need to come up with a model systems at community level. I remember previously, when primary health care was at its peak, we used to have model villages in the communities that used to be a hub for health service delivery. And we are hoping that probably with the resurrection of primary health care, we could probably resuscitate these community or village models that can be used as a support for health service delivery. In short, this is what I can say for the time being. Thank you for listening. I believe we will have time for QA later on. So in the meantime, I'm sure I can take my seat. Thank you.
Where we will get questions and comments from the floor. So if you've got any observations or questions or clarifications that you'd like to get from the presentations that are being made, I will just request that you record them. We will have an appropriate time to do that. But otherwise, thank you so much. That's the Chief of Party. It's quite reassuring to see that she has been in touch with what has been on the ground. Most of the time, the most senior management would like to leave the work to the people on the ground, and they don't follow or know what's happening. But it's reassuring to see that she has been on top of the game in that regard. So thank you so much for that presentation. We're going to move on to the next presentation. It's going to be done by Dr. Kapachika. He is the Onse's footprint at a district level. Rather, he is the Machinga DHSS, and he's going to tell us what's been happening under the Onse project, especially at district level. So let me invite him to come forward and do his presentation, after which we'll be entertained to a performance. Have you heard the Health Education Band perform yet? They are simply amazing. So we're going to give them a few minutes to perform before we get into the panel discussion. But for now, Dr. Kapachika, please.
The Deputy Minister of Health, Honorable Enoch Pale, MP, the Secretary for Health, present, the Office of the USAID, present in the building, and all protocols are observed. So I'm going to briefly present to you what Onse project has managed to yield in our district. So just as a background, our district is in the southern region, and most of us remember us because of Shire River and good fish. So if you want good fish, you come to Machinga and you enjoy. So our population is quite high, 816,370, and we serve them through 16 public health facilities and 7 CHAM facilities. So Onse project achieved the deliverables through 4 thematic areas. The first one was increasing access to priority health services, and this included support to family planning initiatives that we have in the district, malaria project, and also activities concerning child health and neonatal care. So we received such support in our district, and including also family planning campaigns. We happen to be one of the districts with the highest fertility rates in the country, of a fertility rate of 6.6. So this was a very needed support that we had in the district that also helped us in family planning campaigns. So on this one, what we managed to achieve was for the family planning sites, we were able to increase them from 10 to 20 that were done monthly. In addition to that as well, we also had a support for our community boreholes. There was some assistance in terms of wash. We had about 7 community boreholes that were sunk in our district. In addition to that also, we we had capacity building for community Masons. Some of them are the ones that came to present themselves during the previous presentation. In addition to that as well, we also had some support on contraceptives that increased our contraceptive utilization from 40 to 49%. So just to show you, that's a picture of some of the Masons that were trained through the project. That's a picture showing one of the toilets in one of the facilities that was rehabilitated. So in our district, about 3 of them were rehabilitated. That included Gawanani, Sanama, and Nainunje. Next. Okay, the other thematic area that we had was improving quality of priority health services. So the key activities that we did in this one through the project were we had mentorship and supervision. So this mentorship and supervision ensured that our health workers were well equipped and knowledgeable to provide the needed and quality healthcare support to our population. So on this one, the mentorship and support covered family planning. It covered also in terms of maternal health issues, and also it also included the mentorship to the pharmacy team. We are looking at having our pharmacy team well mentored so that we ensure that there are essential medicines in all our facilities at the required time. At some moment, they were trained on how best they could do the distribution of the essential medicine package that we had in our various stores. On this thematic area, our achievement were that we had our health personnel built in capacity. In addition to that, also we had the mentorships were extended to about 20 health facilities of our district. Just as a background, we do have about 23 health facilities, so 21 is quite a good number for our district. In addition to that, also there was revamping of the quality improvement teams and the ward improvement teams. These ones really helped us in terms of quality improvement projects for various things, various issues that we had being done at various levels of our facilities. In addition to that, also we had an increase of antenatal care attendance in first trimester from 11 to 22%. When it comes now to, in terms of nutrition rehabilitation units rates, we registered improvement in death rates, a reduction from 12 to 10%, on default rate from 3 to 1%, and on cure rate, we managed to improve from 79 to 83%. In terms of intermittent preventive therapy prophylaxis, we improved from 35 to 47%. Those are some of the pictures showcasing what most of the activities were already showcased during the pavilion time. So it includes mentorship, supervision, and also capacity building. On the last 2 thematic areas, 3 and 4, which encompassed strengthening performance of health systems and increasing demand for quality priority health services, we were very glad with the project because we have revamped most of our health center management committee teams. These are very important because they provide a linkage between us and the community in terms of addressing issues. When the community have issues, we go through this committee, and when also we have issues with them, they act as intermediates. So there were orientation of these groups. We also had for the service level agreement, in order to increase access to healthcare services, they also supported us supervision on the SLAs. In addition to that, also we had support on CHAGs. They were established and supervisions were also done. In addition to that, there was orientation of DHMT members on ComCare. This helped us in order to help the DHMTs to be able to check the data and make informed decisions. In addition to that as well, as already highlighted from the previous presentation, we are supported with relief duty allowances in our hard-to-reach facilities. So on these thematic areas, our achievements is that the data improved from 80 to 93%, the data completeness. In addition to that, also we had DIP review meetings that helped us to track implementation of our DIP during the course of implementation of the project. In addition to that, also we had improvement in data management since we had donated the ComCare computers. In addition to that, also we had construction of toilets at Muromba and Bonejera health centers. So that's just a picture to highlight the improvement in terms of data completeness and also percentage on time. That's a picture showing us in a data review meeting. It wasn't a lecture meeting, it was within the district. That's a picture showing part of our staff doing community engagement, the one on top. The one below is showing some of the DHMT members being oriented on ComCare. Yeah, coming to infrastructure support, it has already been highlighted. It's anticipation of almost each and every district council to have support on infrastructure. And we are very happy that we benefited through construction of an ash pit and installation of mechanical incinerator at Machinga District Hospital. In addition to that, also we had the same ash pit and incinerator at one of our health facilities, and also the toilets were constructed. It was already mentioned that we had one of our health centers re-electrified when we had a hiccup in terms of electrical supply for a period of almost 3 months. In addition to that, during the time of COVID, we used to be receiving returnees from South Africa. So the Machinga Training College was the site that used to host the returnees. And Onse helped us to refurbish it in terms of repairing of the water supply so that at least it could be functional and the returnees wouldn't get infected due to unhygienic conditions. In addition to that as well, we had the installation of water pump for Namanja Health Center. So that's a picture showing the new mechanical incinerator, the one on your left at the top. The old one is the one below on the right. So that's the outside infrastructure, how it's looking. In addition to that support as well, we also received support in terms of equipment and supplies. On equipment and supplies, we received oxygen concentrators, delivery beds. We had support of printing of maternity registers in order to ensure that we have well-equipped data collecting materials. In addition to that, also our youth-friendly health services were supported with TV screens to ensure that we entertain them and they spend more time with us than go out and make more babies. In addition to that as well, we received support of village clinics, drug box, and other equipment. In addition to all the support, we also received fuel support with those indicated activities. That includes drug and supply distribution, integrated supportive supervision, COVID-19 support, EPI and vaccine distribution, just to mention a few. So the budget that the project spent in our district is the one below, 386,483,860. So these are some of the activities that were supported, and most of them we've integrated them with the other existing activities that we're already supporting. In addition to that, also we have looked for other partners, the existing partners, to help to merge in and help us to work together on some of those deficits. So on challenges, we had challenges with some supplies like family planning commodities. I think it was a national issue during that time. In addition to that, also we had a challenge as well in terms of uptake of family planning, because we had reduced the number of people attending to the family planning initiatives during the COVID-19 period. In addition to that as well, we had a reduction of we had a few number of vehicles to cater for all the services that were being conducted in the district. Just to add on the same, we also had a challenge in terms of the payments of initially at the beginning, payments through the phones for some of the services, for the lunch allowances. That's part of the issues that it improved as we went along. In terms of lessons learned, we have learned that when we increase the number of sites for providing family planning, the uptake also increases. In addition to that as well, the DHM2 supervision plays a very critical role once in terms of mentoring and monitoring, and also motivating our health workers. We have also learned that community engagement is very key. Those communities that were well-oriented played a very vital role in terms of implementation of activities in the project. Another one is that the joint planning that we used to do and budgeting, it also gave us more ownership and gave us a voice to say how best do we model the project activities to achieve the desired outcomes and also conform to our DIPs. In addition to that as well, we have learned that we need adequate funding of essential activities so that we can see desired results. If we are going to fund less to the activities, the chances are that you are going to have less of the outputs that we require being seen on the ground. Okay. Thank you very much for that. Thank you.
Ended rather abruptly. Not the way this project ended, though. It was properly phased out. So thank you so much for that presentation. And again, as I said, if you've got any questions, please just take note. We're going to have a Q&A session later on. But for now, let me invite our most awesome band, the Health Education Band. They do health education songs, but they also do cover versions of any songs. So if you've got activities that you have and you need some entertainment, why not hire them? They do cover public as well as private functions as well. And soon after that, we're going to have a panel discussion which is going to also feature testimonies from the field, and the QHS Vice Chancellor is going to be the one to lead us into that. A short song, please, from the Health Education Band. Thank you.
Oh
be healthy. It must show that they are healthy people. Thank you so much for the energy and the vibe. We really appreciate that. We're getting into our next activity, which is the last part one activity. And that's going to be a panel discussion, after which we're going to have the Q&A. So I will invite the panelists first, and then I will invite the moderator who's going to handle the panel discussion. Let me call forward Dr. Ngoma, the KCH director. Dr. Ngoma, Kamuzu Central Hospital. Sorry, my friend, I've already switched on the cordless microphones over there for the panelists. Do we have a KCH here? Let me call Mrs. Betha Kauza, District Nursing and Midwifery Officer from Waila, to come forward as well. Mrs. Betha Kauza, please come forward. Dr. Alinafe Ngalanga Mjojo, Director of Health and Social Services from Mulanje. Please come and take your position. I will invite you to go and sit over there at the high table. And Dr. Wongani Chikwapulo, Chief Quality Improvement Officer from Ministry of Health. And Group Village Headman Guta from right here in Lilongwe, Chakwaga Budulago, a group of Guta Atabwera. So I don't think we have Dr. Ngoma in our midst. I don't know if they have got a representation from Kamuzu Central Hospital. I stand to be advised on how we're going to proceed on that. Fika nikutsogola group kuti mukakhale nawo pampando umene uli kumeneko. Amene ayendetse mwambo onse ndi Vice Chancellor ACUHES, Professor Mark Malewa. I will invite him to come and take his position, Mr. Mark Malewa. I'm giving you 35 minutes to do your next task. You are the moderator for the panel discussion. I'm the director of ceremonies. Thank you so much.
Our Deputy Minister of Health, Honorable Enoch Pali, MP, Secretary for Health, Dr. Charles Mansambo, Chief of Party, Dr. Ann Poya, all protocols observed. Welcome our panelists. We're missing one panelist, but we're getting a replacement who didn't know that he was going to be in front here, but I know he's a big boy. So the purpose of this session is essentially to allow some institutions and facilities that may not have had a chance to showcase the support that they've received from Onse through either the pavilion or the presentations that have been made. So we've got our panelists here. I'll ask them questions, and then indeed they can take the questions and also add a little bit more beyond the questions that are being asked. So my first question will go to Mrs. Betha Kauza, the District Nursing and Midwifery Officer for Lilongwe District. As you know, Lilongwe is one of the districts that was received full support of the package of services designed to address issues of maternal, neonatal, and child health services. As a member of the district health management team, can you share with the audience the support that your district received to improve access to quality maternal, neonatal, and child health services, including family planning services?
Thank you so much for your question. Indeed, Lilongwe, as a full package district, we benefited considerably in all areas that were earmarked for the project, starting from the district level up to the community level. To ensure delivery of quality services, maternal and neonatal child health and family planning services, Onse supported the district with the development of clinical skills for our nurses, clinicians, HSS, as well as community-based distribution agency at the community level. And also, they supported us with continuous orientation to new clinical guidelines and protocols. And also, they also did a lot on site mentoring our midwives as well as clinicians, coaching as well as supportive supervision for both health areas. We have 6 health areas in the district, as well as district health management team. For health workers to implement these skills, they needed equipment. And Onse supported us with the different equipments like beds, mattresses, tools like photographs. And these assisted our health workers And these assisted our health workers to implement activities without problems. And also, they also supported us with beds, labor ward beds and mattresses, plus curtains for privacy in labor ward at our CMOG facility, like Bwaila, and also different facilities in the district. Through the support in BEMOG facilities, that is health centers and other facilities, they were able to carry out signal functions without any problems. And this has contributed to good management of mothers and neonates in the district. In addition to that, Onse also supported us in revamping emergency triad and treatment in the district. And this mostly focused on identifying sick children and treating these sick children, and also referring them in time to the next level of management. Specific to family planning, Onse supported us with a prefab, family planning prefab, which is at Bwaila Hospital. And this fabricated family planning clinic provides all family planning services. It has also a procedure room where permanent methods are being carried out, like vasectomy and tubal ligation. And there is also a space for males and youth where they can access family planning methods without compromising their privacy. And to improve access to essential health services for population in underserved population and hard-to-reach areas, Onse supported us with fuel and lunch allowance to conduct these outreach clinics on a weekly basis. And through these outreach clinics, underserved population accessed family planning, antenatal and postnatal care, counseling and nutrition for both under 5 and pregnant women, and general outpatient care, including diagnosis of malaria and also treatment of malaria, plus HIV, AIDS, and counseling, plus other services. And coupled with these services, Onse also supported our specialized clinical staff at Bwaila, and this staff was going out, or is still going out, to other facilities in the district to carry out permanent family planning methods like vasectomy and tubal ligation. And as of now, as a district, we are proud that we are one of the recipients of modern mechanical incinerator that has transformed our waste management as well as other infection prevention measures. And also, apart from that, a number of health centers in the district have also benefited from the support by being provided with waste disposal areas like placenta and ash pits and regular incinerators. I know that the list is lengthy for Lilongwe district because it received a full package. However, let me thank Onse for the support which they rendered to the district during the COVID period. They were involved mostly in airport screening. On our own, we could not manage, but Onse supported us fully on airport screening, and also transportation of specimens from the site where they were collected to the site where they were tested, and also vaccination campaign. They did a lot on vaccination campaign. That also increased access to COVID vaccine, and that's why we had so many residents in Lilongwe as well as in the rural areas accessing this vaccination. I hope maybe let me stop there, but thank you so much to Onse for the work which you have done to the district, and also let me thank our coordinators, the ones who are coordinating this program from Onse, Violet, and Kempston. There was really good coordination and cooperation between Onse and the district. That's why we managed to carry out this task. Thank you so much, Onse, for the work well done in the district. May God bless you.
Thank you very much, Mrs. Kauza. Can I now ask Dr. Alinafe Kalangam Jojo, the District Health and Social Services Director in Mulanje. The testimony we've heard from Lilongwe has just given us a flavor of the kind of support in the area of water and sanitation. Okay. This is an area that is often overlooked when we are discussing issues of universal health coverage. Can you share with us how Mulanje used the Onse project to promote water, sanitation, and hygiene in the district? Dr. Kalanga Jojo.
Thank you so much, moderator, for reminding us that indeed we cannot talk of universal health coverage if we are not discussing issues to do with the water, sanitation, and hygiene. You may wish to know that Mulanje, in the just ended Onse project, we were designated family health package. So we had all the interventions except the malaria. The chief of party have been mentioning that health begins at the community. So indeed, in Mulanje, with support from Onse, we had the interventions, WASH interventions that focused both at the community level as well as at health facility. Knowing very well that having safe water at the community is very paramount in preventing the diarrheal conditions, which even includes cholera that we are battling with now. Through Onse in Mulanje, they helped us repair 212 boreholes that were non-functional. And they did not stop there, because they knew that community participation is very paramount. They had trained water point committees, which are responsible in making sure that the areas are clean, equally the water, as well as the maintenance. So they don't have to come to the DHO and say, maintain our boreholes. They are there in the community to take care of such issues. Apart from that, Onse has helped us as Mulanje to construct the improved latrines. The chief of party had given a number that in the whole project they managed to have 2,000 and something latrines. You may wish to know that Mulanje benefited more than half. I think, thank you so much, Onse, on that one. Probably that also explains why now Mulanje had registered a single case of cholera, but we have managed to cut the transmission because a good number of our people in Mulanje have improved latrines in their homes because of support from Onse. And we did not stop there. We also, with the help from Onse, managed to declare one of the tiers, which is Chikumba, as an open defecation-free zone. And you know, it's beautiful, the innovation that Onse brought. It's called Impondagia. I don't know if you have seen it. It's a foot-operated, locally made hand washing facility, which in the homes they have. And you know, as we all know that hand washing prevents a lot of diseases, including COVID, cholera, and what have you. So you had seen the beautiful two women that were here. They are coming from Mulanje as masons, that they were trained or capacitated by our Onse project, so that they are able to construct improved latrines using the cheap available materials, and they are there helping the community, other members of the community to attain the same. So now, knowing that if these fail at the community, the patient or client will still come at the health facility level. Onse, working with the DHO, together with the health center management committees, we had sat down and then say, what issues do we have in our facilities that Onse can help us? So together we had brought up the issues, and you ended up doing a number of action points, which included the construction of a number of sanitation facilities, like even the VIP toilets in the facilities, placenta pits, ash pits, as well as the incinerators where we did not have. It happened in a number of facilities, but just to mention a few, that we had the Jambe, Kambenje, Mlomba, and Namlenga. And also helped us to reticulate the water systems. You know, some of the systems are odd and they end up leaking, thereby not delivering water at the end point. So they had done the plumbing works in a number of facilities, and also they didn't end up there. They had to drill some boreholes and bring up some water pumps to just make sure that we have water at the point of our service. Last but not least, let me also join Lilongwe. As they're saying, they are celebrating for having the mechanical incinerator. It's really beautiful the way it works. You know, it can burn a 50 kg waste at once with less fuel that it uses. So I think that's what we need. We need technology. Like Mulanje rains now and then. You can't say you go and burn the waste outside in the other analog incinerator. So thank you for bringing the technology. We would wish to have them even in other facilities that we have, like Chonde and Tuchira. Lastly, I think I can't close without saying this story, which is a sad one, but it was made beautiful because of Onse. With the just gone cyclone Anna, it happened that even the district hospital was affected. Our waste zone got sunken, including the placenta bit. So imagine that the mother hospital had to transport the placentas from the labor ward to a nearby facility. When we had asked Onse, I think within days, they did an amazing job, and then they restored our waste zone. Thank you so much, our partner Onse. I think lastly, equally, let me thank you so much. I think even now that I'm sitting here, the gap is being seen that you're not there. We might not tell you, but it's there. So the work that you're doing, it was really complimentary to us. And I shouldn't go without mentioning that you didn't bring anything new, but you were there to complement the existing plans or our visions that district had. I think that's one of the coordination, the collaboration and the complementarity that we need from partners. We don't want to bring anything that will not help us as districts. Otherwise, I think through the planning department, I hope momentum will come soon before we sink. We need support at the district so that we continue with services, and also be assured that as management, we will not let the gains that you have made be lost. Otherwise, we're going to maintain them so that we should always remember that we had Onse and we managed to do ABCD. So, moderator, let me stop there. Thank you so much.
Thank you so much, DHSS Mulanje. Thank you. Dr. Salim Zinkanda, you were in the thicket of Cyclone Idai. How did Onse come to your rescue during the period? How was their response in emergency situations?
Right. Thank you so much, moderator. I think, first of all, to say that as I was waking up, the moderator said that he's a big boy. So if I fail to respond, it will simply mean that you did not do a good job when I was in college. So to respond to the question that how Onse has been responsive and flexible to health services in Chikwawa, is that indeed Onse has been quite very responsive to the needs that are emerging there. that you might be aware that in the government planning system, in the budget allocations, we do not usually put aside money or resources for emergencies. And also, even when you are doing the expenditure within the financial year, we also do not have much flexibility in terms of the expenditure. But basically what you are able to do is to once, probably in a financial year, to do some environments, to move some budget lines within possibly maybe 10% or thereabout of your budget. So what that means is that whenever there's an emergency, you will not be able to do any changes in our budget and expenditure. Now, we should also be aware that as we have been the past 2 years, the country has been facing a lot of emergencies, like issues like Cyclone Anna, Cyclone Idai. We also have had the COVID-19, cholera, and other emergencies that have been coming up, including polio. Now, Onse has been so handy in such circumstances for us, specifically for Chikwawa being one of the worst hit as a district in as far as some of these emergencies are concerned. So Onse came in several times. I'll give maybe 3 examples only because I do not have all the time. That they came in to support with us with the renovation of Chapanagahe Center when it had been blown off by Cyclone Idai. But also they also even supported with the water restoration in some of the facilities that due to the same emergencies they got broken down. They came in and to support us on that. In addition, when we were also working towards against the COVID-19, including the vaccination, Onse has also been very handy. They came in very flexible, asking us what we need. We told them what we needed, and they quickly came in and supported us. But lastly, though not least, when we also had the Cyclone Anna, which saw about half of the population of the district displaced, and also which landed us into a situation where almost all health facilities were not able to do any referral to the district hospital. At that point, Onse came in to support us in various areas, including the mobile clinics. So they indeed supported us to manage to go and check the people within their localities and the camps where they were camping. And that, I'm sure, helped saving some lives and also helped saving some of the issues within the system. So once again, I would say that Onse has been so responsive and flexible, and I believe that as we're closing the project, the USAID should be able to probably now be flexible enough to leave some of the vehicles that they were operating on, so that we should be able to use continuing with the services in the districts. But otherwise, yeah, Onse has been quite responsive. Thank you so much, moderator.
Now, Dr. Bongani Chikwapulo. From the many articles, so Dr. Bongani Chikwapulo is the Chief Quality Improvement Officer in the Directorate of Quality Management. Many articles have been written on health system strengthening and quality improvement in service delivery. We have also much learned about the importance of leadership and governance. How did Onse demonstrate their understanding of this importance in supporting the ministry to cultivate a culture of governance and leadership in service delivery?
Thank you very much, moderator. It is quite impressive to hear testimonies coming from the district, looking at what Onse did in improving quality. So apart from Onse's efforts in working with the district, they also worked directly with Ministry of Health departments, and one of the department was is Quality Management Directorate. For some that do not know, Quality Management Directorate is as old as the project. It was also established, the one was established in 2016 as Onse was just starting up. So within the Health Strategic Plan 2 implementation period, the department was guided by 7 key priority areas that were selected by stakeholders to holistically improve quality. And one of them is leadership, governance, and accountability. And you may be wondering why we're talking about leadership and why we're talking about accountability when you're talking about quality. For your information, we need strong leadership, visionary leadership, to create an enabling platform for quality improvement to be done. And also for sustainability of these many interventions, you need visionary leadership. The importance of accountability in quality can also not be emphasized. The client, the Malawian, has to be at the center, has to be involved in the in ensuring that the services that are being provided are of best quality, are serving the interest of Malawians. So in leadership, Onse Health Activity supported the ministry through Quality Management Directorate in integrated supported supervision. So they supported with a review of the tools of the supportive supervision. They also supported in digitalization of the tools and also development of a visualization platform of results from supervision. At the district level, they provided tablets. Yeah, so the supervision is done electronically. So tablets are a critical tool during the supervision. They also supported, they went further to support logistics, support to enable district health management team to do supervision. And this resulted in improvement of supervision, getting the senior management at the district closer to primary health care facilities. They also supported development of leadership training materials for health center management teams. The technical team that is running the day-to-day, that is responsible for running day-to-day affairs at the facility. So they supported the consultative process to come up with tailor-made leadership and management training materials. And at the district, they have also supported training of 54 in charges in 3 districts, Karonga, Balaka, and Salima. Under governance, at the district council level, they also supported capacity building of the health and environmental committee. As you're aware, this committee is very important in overseeing provision of services in the district. At the district hospital level, they also supported capacity building of drug therapeutic committees. These are committees that are responsible for procurement of medical supplies, and also they monitor use of medical supplies within the facilities. At health center level, and I think this has been mentioned already, they supported capacity building of health center management committee, a committee that bridges the gap between the facility and the community. They are also very important in monitoring of drug uses at the facility. Going into the future, as quality management and I think generally Minister of Health, we're quite excited with what has happened in the past 6 years. And we're hoping that the foundation that has been made will also go into the successor project momentum. Yeah? In the health sector strategic plan 3, as quality management, we would want to accelerate the quality improvement at the facility so that Malawians can be able to appreciate the quality of the services that they're getting in our facilities. So we're hoping that during the implementation of momentum, the US government will be able to support, will be able to collaborate with ministry in rolling out the stepwise quality improvement program using accreditation standards, where facilities will be leveled according to stars. Yeah? And facilities will be supported to move up the stars so that they can be able to provide the best care possible, so that our mothers and children are able to access the best care. And secondly, another key area is also to strengthen our collaboration with the academia. I'm happy that the moderator is coming from the academia. we would want research in quality. We would want to have local solutions, yeah, for the interventions that we're pushing in quality. Yeah, most of them have been borrowed from elsewhere, but I think it's high time we're able to define what does quality mean in our context. What does quality mean to a local Malawian? We would also want to strengthen, for our health workers, most of them have to know quality approaches within, as they're coming into the industry, in the colleges. So in the HSSP3, we would want that we have quality modules in each and every course in Malawi that is teaching health workers. So lastly, we very grateful with the intervention that have been seen in the past 6 years, particularly in the leadership and governance. And we're hoping that this collaboration, this fruitful collaboration will continue as we're implementing Health Strategic Plan 3. Thank you.
Thank you, Dr. Chikwapulo. Amfumu Guta, tathokoza kwambiri kuti munabwera kudzakhala nafe limodzi. Mmene tikambirana zinthu zimene onse akhala akutithandiza. Ndifuna ndifunse kuti inu monga mkulu wa mudzi mwanu, udindo wanu ali wotani poyang'ana zinthu zonse zomwe onse akhala kuchitira mdera lanulo? Zokumamira mfumu.
Zikomo kwambiri chifukwa cha funso lanu. Bungwe la Onse linafikadi mu 2016. Choyambirira anali kukumana ndi ifeyo mafumu poyambirira maka kutiwuza za cholinga chimene iwo anabwerera. Titawavomera anapanganso misonkhano kukumana ndi anthu akumudziko. Misonkhano yawo inali kuwaphunzitsa anthu kuti asamapite kutchire kukadzithandiza, koma azipanga zimbudzi. Zimbudzizo zampondagiya komanso timayikapo sopo kuti akamaliza azitha kutani kumasamba. Ndiye ifeyo mafumu ntchito yathu inali kuwathandizira kuti ntchitoyo iyende bwino, chifukwa iwo okha sangakwanitse, chifukwa mafumu ndi amene timadziwa anthu athu. Ndiye iwo anaphunzitsa zambiri kumaderako. Anthu anadziwa kudzidalira, kukhala ndi zimbudzi, kukhala ndi mabafa, kukoza zingwe zoyanikapo zovala, komanso kukhala ndi nkhuti zotayamo zinyalala. Zonsezo anaphunzitsa ndi gulu la Onse. Komanso sanalekere pokhapo, anathandizira azimayi kuti akayima adzipita msanga ku chipatala ukayamba sikelo. Komanso anathandizira ana madyedwe abwino, ndipo m'midzimo amaphunzitsanso kuphika phala. Example la ndisakanizeni limene amasakaniza magulu osiyana-siyana zakudya kuti anaja asamanye nchere. Kotero kuti kubwera kwa bungwe limeneli ineyo naona kuti kwathu kunasintha kwambiri, chifukwa mavuto tinali nawo poyambirira anachepa, komanso ngakhale anaonyenchera simene nambala inalili. Pano pare kumachita usowa kuti mwana osamuonako otani onyenchera, kusonyeza kuti bungweli lagwira ntchito yotamandika kumadera kwathu. Komanso anaphunzitsa anthu akwathu kumadera kupanga timagadeni tapakhomo azipeza ndiwo mosavuta. Komanso kaya anapita kwina kokayenda akabwera madzulo tele angopita kadimba kawo kapakhomo apeza kuti ndiwo rawo ndikuphika. Ndiye kuti zonsezi anthu kumudzi adziwa chifukwa cha bungwe lachani limeneli. Ndiponso kuonjezera pomwepo tikakhudzana ndi COVID, amene wasarengako gawo lalikulu chifukwa anapitiriza kutiphunzitsanso kumaderako kuti anthu azisamba manja pafupi kugwiritsa ntchito sopo komanso azitha kugwiritsa ntchito masiki komanso kukhala mosatithika ndiponso ngakhale m'maliro lero sitilola kuti anthu azikhala masiku ambirimbiri m'maliro zimenezo zasefukira ngakhale kuboma chifukwa kubomanso amatiuza inu mafumu mukakhala uko musavomere kuti anthu wamwalira lero akhale masiku 3 ayi zimenezo tikutsatira chifukwa cha bungwe limeneli kotero kuti kwa ine bungwe limeneli ndisaname maphunziro pafupi ndiponso amapereka ma allowance anthu akachita maphunziro mwakuti kunena zoona ikakuti amayika pasikelo kuti kodi mabungwe osabwera muno bungwe lachita bwino ndiliti upezeka kuti lidakakhala onse mabungwe amabwera ndithu situnena kuti sachita bwino amachita bwino koma tikafuna kupeza amene atikadayika pa namba 1 kotero kuti ine gulu ilili ndisaname chifukwa choti kuso anthu kumudziko anali ndi chidwi ndi chifukwa chakenso kwakabudula teti tinatenga chikho tinalandira ndithu chikho choti timakutagwirizana nawo ndi zimene iwowo amatani amalankhula ndi bungwe lofunika lothandiza koma chimene ninganenepo nchakuti ngati ine chimene ndaphunzirapo ndikoza kuti zimene iwowa akhala akutiphunzitsa nanenso ndi mafumu azanga tilengepo gawo anthu kuti asafokere apitilize zimene onse atiphunzitsa zikomo
tathokoza kwambiri mfumu mawu akulu mwakamba ndithu zikomo kwambiri. I had no idea. I knew that Onse is doing a great job, but honestly, I didn't know the extent to which they are working there. So Dr. Poya and all the Onse is congratulations to you and a big thank you. At this juncture, I'll pass you back to Mr. Joab Chakadza to continue with the proceedings of this session. Thank you.
Thank you very much. Another round of applause to the moderator, please. Thank you so much, and thank you for doing your best to stick to time, and thanks for ably handling this session. We're getting into the very last session. I'll request that Onse helps us take the microphones around because we're getting into the Q&A. And since we've had several presentations and speeches, we might have general comments that we want to make, but if we've got a specific question that we would like to ask, then please be clear who that question is being directed to. Let me see by show of hands the number of people who want to give us their feedback as we are winding up. Questions and comments. Aminali ndinde manga kapena mafunso nthawi yathu ndino pamene tikuyandikira kumapeto kwa mwambo wathu. Ngati muli ndi funso tikupemphani kuti munene kuti funso limenelo likupita kwa ndani, komanso ngati mungakwanitse mudzipange introduce mukamafunsa funso lanu. Ena atenga microphone asanayambe kuyankhula amenewo ndafuna ndione ngati aliponso ena amene akufuna kupereka ndemanga kapena kufunsa funso. All right, so let's hear from you, sir.
Thank you so much. Hello?
Yes, we can hear you.
No, thank you so much, Joab. My name is Mazgu Matemba. I'm the Community Ambassador. Let me thank Onse because I participated in some of the supervision within the project over the 6 years period. I'm happy looking at the wind up, the recommendations. One of them, the more specific on ownership at community level. I'm saying this because in the previous presentation by the Director of Planning, the Minister, the PS, and others have mentioned that the area which we need to invest on, moving on, is the community level. So my question is, apart from the specific recommendations which has been spelled out at the next level of engagement, whether other partners or through the Onse project, what could be one or two game changers, like the field of change, which they have identified that maybe in future those can change the way things are supposed to be done at community level in terms of ownership and also the leadership of those interventions. Thank you.
Thank you very much for that question. Any other views and questions from the floor before I invite the relevant authorities to come and respond to that? Okay. All right. So Mwambi, does that question go to Onse? Does the Chief of Party want to come and respond to that? If she can't handle it, I'm sure she'll advise who can. After she has answered that question, I will invite Mr. Ruben Ligoe, the Onse Portfolio Director, to come forward and offer a vote of thanks. But for now, let's listen to how you wish to respond to that question. Dr. Poya.
Thank you, Community Health Ambassador, for your question. I was actually thinking that I should have raised my hand to ask you this question, that as a Community Health Ambassador, what do you think we should be doing to improve community level activities? But my attempt is something that I said in the recommendations, is that now we have revitalized, I'm not sure which WHO assembly was that one, probably the PS will come to my rescue. I think it's the last 2 or 3 years or so, when the concept of PHC was revitalized again, that we need to focus more on primary health care. So our recommendation as Onse is that let us go back to the communities and set up the model of villages. At a model village in the 80s and the late 70s, those of us that were still alive and born and were practicing, we had created these model villages where all these initiatives that we are talking about were implemented at community level or at village level, headed by the village health committee. We are talking of the latrines, we are talking of the pondagias. It was, those things were based at the village. We are talking of the community garden, it was done at the village. So there was no issue of the marinoist or the stunted growth, because the community was growing food, they would feed their children. Those were the initiatives that brought in the home for the TBA. If you remember, we had the TBAs who were also being looked after by the village health committee as part of the model village. So my recommendation, Bwana Community Health Ambassador, is while government is looking at building these 900 plus health posts, let us go to the community, bring up these community or village health models that would now be implementing a package of interventions at the community, so that when now they have challenges, then they can go to the health post as a referral area. We would recommend that the village health committees come up with a transport system. We saw the community in Doha that were showing us. They came up with a stretcher on a push bike so that they can push the mother forward for advanced care. So I think that's what I will be recommending for you. And another game changer is we would want, because we know even if we have a model health village, not everything would be treated at the village. There is need to have a functional health center. That's why we are saying that the people that deal with the budgeting issues, I'm looking at the Secretary for Health to come to my rescue in the future. Can we decentralize the budget to the health center as much as we can? Because that is where now everything happens. But as of now, health centers are at the mercy of the district level. They are only given supplies, not the actual money. But if they need to buy something, they won't. So we need to create a trusting relationship between the community and the health center. But if the health center does not have resources to respond to what is happening at the community level, then we're as good as not doing anything. I think I would want to rest my case there. Thank you. If we have other people from Onse that would want to support what I have said, probably we can give them a second. I don't know, Dana, you want to say something? Or you are okay? Thank you.
Thank you very much indeed, Dr. Poya, for that. A small correction on the vote of thanks. I will have to call forward Mary Ellen to come forward and give us the vote of thanks, after which we will invite our guest of honor, Deputy Minister of Health, to give us closing remarks. Thank you very much.
Deputy Minister of Health, the Honorable Enoch Pillay, Secretary of Health, Dr. Charles Monsabo, Deputy Head of Health, Nutrition and Population at USAID, Dr. Lily Banda. All other protocols observed. What an afternoon, what a morning. This has been great. I am so honored to have been asked to offer the vote of thanks on behalf of the entire Onse project. As to be expected from a project that is called Onse, and an event with a theme of together for everyone's health, there are many to thank, but I will be quick so that we can all get along and enjoy some refreshment. First of all, I want to offer sincere gratitude to all of our distinguished speakers and guests from our morning session, the Honorable Minister of Health, the Honorable Deputy Minister of Health, His Excellency, the U.S. Ambassador, the Secretary for Health, the Ministry of Health focal person, the MSH Vice President for Strategy, the USAID Mission Director, the Deputy Head of Health, Nutrition and Population at USAID, as well as many other senior USAID folks. It was inspiring to hear their messages and words of appreciation, but their commitment to the work that continues, and the powerful stories they shared of individuals affected by the work. I want to thank Dr. Foya and Dr. Kapachik from Machinga for their presentations that showed the full breadth of intervention and results attained through the 6 years of the Onse project. I want to share our appreciation for the distinguished panel members we just had here, who eloquently and powerfully, it's a word I was going to say a few times today, shared many specific examples of their partnership with Onse, and hearing the voice of the field, as I think it's listed on your program, that's essential. That's where the work is, and that's why Onse as a project was here. So it was wonderful to hear those stories and those effects and those challenges, many of which still remain. A truly, truly special thank you to the pavilion architects and the presenters. They were powerful, again powerful, demonstrations and sharing of their firsthand experience. It showed the impact of the partnership. These presenters, some of them traveled from quite far away to be here with us today, and we really appreciate that effort. I also thank the Chief from Lilongwe for joining us and the champion community from Doha. It was so wonderful to have you all here, and for, I think some of the pavilion's material is still up there, and if you didn't get a chance to look at it earlier on your way to luncheon, you give it a look. I want to thank the delightful, where are they? The Health Education Band for inspiring us with their music. I wanted to dance a little, but it's good that I didn't because I'm not very good. Congratulations and thanks to the organizers of this event. It was a complex event and task, but I think we can agree it was beautifully realized. And of course, we, as Onse, want to thank all of you, including folks who may be watching through either Facebook Live or YouTube later. We want to thank all of you for joining us today and your support of Onse and your partnership with Onse these last 6 years. It's been truly an honor to get to meet some of you finally, as I come from the US. But I know you've been working side by side with my colleagues here in Malawi, and that's really something that we're incredibly thankful for. And one last thank you, and that is to our Director of Ceremonies for leading us all through what I hope was an inspiring and informative day and a celebration of the work that has been done these last 6 years. And I will turn the mic back over to him to bring us to a close. And I will share the one word I am confident in saying in this country. I've learned others, but I'm not confident in saying it. But I know how to say, and I mean Zikomo. Thank you.
Thank you, Mary Ellen. We appreciate your effort to learn Chichewa, but Zikomo is too basic, please. I mean, next time let's do better, okay? All right. Yeah, Zikomo is too basic, at least a sentence or something, but we'll work on that. We'll work on that. Thank you so much for that. And the Health Education Band might want to consider her, you know, because I saw that she likes the reggae vibe, so maybe she might want to perform one song with the band. We're getting towards the end of our event today. Allow me to invite the Deputy Minister of Health, Honorable Enek Pale, to come forward and close this conference. Thank you.
I thought you were going to do it. I know Job was rushing for lunch. That's why he quickly pushed on the Honorable Minister to close. But I need to thank you all for being here from the morning until now. I need to thank Onse for the wonderful work they've done in the 16 districts. I know it was a lot of work. But the good thing is that all is not lost. I know there are a lot of questions as to what happens next. I've been reliably informed that there is momentum coming. So just get ready for the momentum. At this point, it's now my singular honor to request the Honorable Deputy Minister to formally close out Onse, but that doesn't mean a stop to all the activities that have been happening in the districts, because as we heard from the presentations, you are all empowered to carry on with the work that Onse started. With these few remarks, I would request Honorable Deputy Minister to come and formally close this particular session. Thank you.
The Secretary for Health, Dr. Charles Mwasambo, MSH Vice President responsible for Strategy Development and Partnership, Madam Dana Sandstrom. I hope I'm right. That's it. Thank you. The Deputy Head of Health and Nutrition at USAID, Madam Lile Banda, the Community Ambassador. I saw, oh, you're still here. I thought you've rushed for lunch. Mr. Maziko Matemba, the Vice Chancellor at CUHES, Professor Mark Marowa, the District Commissioners present here with us, together with your Directors of Health and Social Services, Chief of Party for Onse, and in the interest of time, let me say all other protocols observed. I'm not meant to keep you longer here. I know it's lunch hour. We need to go and now have a rest and also prepare our travel back to our various duty stations. But I'm here for a few things. One is to recognize your presence. I was with you together with the Honorable Minister from the morning. We never expected you to be here up to the end of the conference the way you are. Quite often when there is an opening and few presentations are made, you see people disappearing. But you've kept yourself here. It shows the commitment you had to own the project, and you are likely happy to celebrate the achievements the project has recorded. As a ministry, we are indeed grateful to see the extent to which the project has gone in supporting service delivery, as evidenced by the various presentations that were made here, and also walking through the pavilions that went through with the Honorable Minister. Therefore, my plea to you all, especially the district health management teams, the directors of health and social services, with support from our district commissioners, is to go and take care of the equipment and the infrastructure that the project has invested in. Let us use the PALM staff that was involved in infrastructure to maintain our structures. I'm happy to learn from directors of health and social services from Chikwawa, and I think I'm Machinga, that you are prepared to sustain interventions that were supported by the project. May I call upon all the HMTs to do the same. Lastly, as I add on the advice that I want to give to you, looking at the huge investments that we've witnessed, one key important thing is that we must not lose focus. Let us not lose focus. Yes, we are supported by Onse, who is to be supported by various partners that will be coming in, who continue the advocacy as MOH, advocacy for good policies and provide safer spaces for service delivery. But in terms of implementation, it's you at the districts. So let's not lose focus on this. Teamwork is very key. And I want to emphasize all the teamwork. I've seen projects starting, projects breaking, because people have not maintained the discipline of teamwork. Lastly, let me congratulate the Onse team and MSH for the successful delivery of the project. Agogo muchichewa pang'ono timanena kuti tikuthokoza makamaka kuti kumudzi kuja mumayimirira anthu onse pamene timayendetsa project imene anatithandiza abwenzi athu awonse. Tikuyamika kunena kuti ndinu mboni kuti kumudziko timatenga nawo gawo mmene tikumalizana ndi project ya Onse pano. Tikunena kuti tiyeni tisataye chidwi chathu pa zimene tayambapo kale, nkofunika kuti tikhale ndi umwini wa maprojekti amenewa. Muja tamvera kudowa kuti pano palibenso wana onyenchera, kunyenchera kuja kukhoza kubwerera ngati sititengapo umwini. Zonse zimene amatiphunzitsa zija zimene zimatilimbikitsa bwerani dzalandeni maphunziro, inde amatipatsa kangachepe koma kangachepe kusiyankho iyayi, koma nkofunika tikhale ndi umwini weniweni kuti tisabwererenso mbuyo iyayi. Kuja gogo munanena koma sanza athu amene mwachoka kumudzi tisimumalimbikitsa anthu kuti adzikapambukira kutchire. Ndi zabwino kwambiri kuti tipitizebe kukhala ndi zimbudzi zija timakhala nazo zija timaonerapo mpaja paja. Mmene mukubwerera tikufuneni zabwino zonse agogo amene munabwera kuyimira magogo onse komanso tonse amene tikubwerera. Thank you so much for your attention. Thank you.
Thank you very much indeed for those remarks. And I think those qualify to be called few remarks because they were few. When we were starting, we had Father Mtega. I think I still see him around. Maybe I can invite him to come forward and close this event with a word of prayer. Father Mtega, please.
Let us pray. God, our loving Father, we thank you for being with us during the whole ceremony. We started with you and we are closing this meeting with you. We would not have done anything without you. We plan, but you established the plans. And so we thank you for making this meeting a success. During the whole ceremony, we have learned so many things, and we would like to ask you to help us to be able to be pushed into an action so that we continue to bear fruits in our communities. Bless all the people that have taken an active role in the implementation of this project. Bless them with your intelligence, but also courage to be able to break through and come to a happy conclusion. We continue to ask you to bless all our efforts so that they may be sown for an eternal harvest. We make this prayer through Christ our Lord. Amen.
Thank you very much indeed, Father Mteka, the Deputy Secretary General of the Episcopal Conference of Malawi. And this also marks the end of this dissemination conference. There is a service being provided at the back where you can get a COVID jab. 13 people have gotten jabs so far while the conference was in session. Thank you so much. A round of applause to them indeed. And if you'd still like to get a jab, go ahead and get one. Otherwise, lunch has been prepared at Vincent's restaurant. If most of you don't know where it is, you will make your way past the swimming pool. It's further closer to the hotel. The Health Education Band, let's give them a huge round of applause. I think they've been amazing. And they will be serenading us to some music as we are taking leave of this place. So just make sure that you get a meal coupon as you're going. There are some people who will be served by the swimming pool and some will have their lunch at Vincent's restaurant. So be sure to check your meal coupon where you're going to have your lunch. Chonde tipeze ma meal coupon kuti tikalandire chakudya. Pa meal coupon ipo alemba kumene tikalandire chakudya. Ena akalandira ku Vincent's restaurant, ena ajera pa swimming pool pachatenda kapangira ma refreshments pacha. Otherwise, thank you so much for coming, and I wish you all the best. Enjoy the rest of the day. Thank you.
As a champion community, tinachiona kuti tili ndi mavuto akuti kuno kudera kwathu kwa Chakupomba, tinakhala pansi nikuganizira ndikulingalira kuti vuto lathu ili monga mavuto tinapeza atatu. Pa mavuto atatu imene nakula kwambiri ndikudwala kwa ana ndi malume. Zina langa ndine Clayton Steve Chingaliwa. Zina la gulu lathu ndi Chakupomba Champion Community. Ni Champion Community monde ne secretary. Chomwe chinatipangisa kuti tipange chitukuko chimenechi ndi mavuto amene timakumana nawo aja tinanena kuti ndi mavuto atatu mdera mwathu muno. Kudwala kwa ana under 5 komanso malaria ingani ya nutrition. Champion Community azimayi amakumana ndi mavuto kuti akachoka kunyumba kwawo kuti azipita ku health center imene yochuluka makilomita 7 amaberekera njira kukafika kuchipatala atabereka kale mchini. Vuto limene linatikuza kwambiri ngati za Champion Community. Ndiye tinakhala pansi ndikupanga chiganizo choti timange clinic. Chimene chinatipangisa mavuto amene. Kale zinthu zimakhala zovutirapo poti chipatala chinali kutali kwambiri. Koma pano tikuona kuti zinthu zikuyenda poti chipatala tamanga ma service onse timalandira pompa. HSA athu amachoka kuchipatala kuja kutali kuja kubwera pano zatipasa ma service onse. Ndiye zimationesa kuti pano tayombako kuti moyo wathu uli bwino kwambiri. Zinthu zasintha kusiyana ndi kale. Budget yathu ngati community imene tinagwirizana kuti timange clinic inali ya 3 million. Ndiye ndalama zimene zinazipezera mbira zitanena kuti tinasegula matimba. Kenako tinapemba chibara imene kusafirika kudera konkuno anathandizanso ndalama yokwana 600,000. Masomphenya athu ngati Champion Community tikufunisisa kuti chipatala chimene chikhale zonse zofunikira ngati chipatala tikufunika kuti HSA akudecho atithandize kuti azikhalira pompano ndipo timangira nyumba chimbuzi toilet zosakhala nawo. Ndiye tikupempha kwa decho kuti atipeze HSA kuti azitithandizira konko. Madera athu tikufunisisa kuti tikafikire kuti zaphunzitse ubwino wa Champion Community kuti aziwe kuti Champion Community ndi chani, kuti Champion Community imatani. Ndeti ndichilakolako kuti siku lina tizaphunzitsa kwa sathu kuti atengere zimene tikuchita.
Apo tikasamukiranga kuno kuti mfumu anayamba ntchito yampanga post ngala kuti nina mwana kale uyo akawa kututuwa chomene. So ine magazo ane kuganzange ti mwana ni wakututuwa waka ni thupi lake. Ngazafika kuno mbwe ngasanga chairman wa Champion Community au akunifumba kuti mwana uyu utena yokochi kuchipatala. So ine ngati chichi auti mwana uyo oneka kuti osowekera chinthu chinyake mthupi mwake.